afternoon, and thank you everyone for being here. This is the COVID-19 Financial Oversight Committee. It is December 8th, I think. And we, of course, as usual, have a very full agenda. So thank you all for being here and participating. I hope for our committee members you have pre-read. We will try to keep things moving. I know these meetings go long. We'll try to keep them as short as possible. We are going to start with something that we weren't able to complete at our last committee meeting, which is the survey that we would like to have on the hub as part of our community kind of engagement and feedback. So we have already heard from Metro Social Services, which provided kind of a current state of the county when it comes to priorities and some of the issues specifically with our poverty and lack of access and the other kind of social situation that's facing Davidson County and Nashville. So we have an idea from that. We also have our Equity Alliance report from the beginning of the pandemic, but we really want to hear from the community. So we have put together this draft that as we ask the community to weigh in, we also want to have some context. So you have the hub survey, which starts with a background, just to briefly explain what the American Rescue Plan is, what its intended use of funds are, and then to give them, the community, an idea of our guiding principles. So we have those principles that are listed and saying, okay, those are the principles. That's where we intend to provide our funding. And so more specifically, we listed out the items and we want them to then, on a scale of 1 to 5. So they don't have to pick just 5 items. They don't have to pick a 1, 2, 3, 4, 5. They could rate every single one for each item and give it 1 being very important, 5 being not important to them. And then with that information, we could start to have a weighted kind of glimpse of where the community would like us to focus. And of course, then the second is just an open, what are we missing? So that was the idea. This is something that could be put on the hub. And we have done other surveys throughout the community using the hub. It would allow us to then pull the information, tabulate, share with the committee, share with the community the results. So after you've had a chance to look at that, are there any suggestions, questions, comments? I got to figure out where everybody is, yes. Councilwoman Gamble?
Wondering if you are.
Would you like mine? Okay, I can bring it up. Yes, I got to figure out where everyone is.
My question is, how long would the survey be out?
You know, I think we want to leave it up for 10 to 14 days. If we think we need longer, we can. I welcome your input. I think we just want to make sure we have enough time for people to respond. You know, multiple rounds of press release, you know, news stories. You all may want to, you know, we would ask all the council members, not just our 3 committee members, but all the council members to get it to their constituents. So we have a pretty robust way of getting it out to the community, but it doesn't mean everybody sees it on day 1.
The past hub surveys, how long have they been out?
I don't know the answer to that. I'd have to. Let me, Sarah, I can't see. Should be on.
Yeah, I was just wondering kind of what the history is of these surveys in terms of the number of people that have participated in other ones, and just sort of whether or not they've been impactful, and whether there are any lessons learned from past ones about how do we reach the people that we want to reach.
I'll follow up on that also. Any other, oh, yeah.
I just had some thoughts on how to maybe make this a little bit easier to navigate for folks, because some of this makes sense to us, but it may be sort of information overload for a lot of people, so we may be able to sort of simplify some of this. And then I also wanted to ask things like vaccination, testing assessment centers, PPE, signage, and supplies. Should that even be in there? Because I think that's not negotiable, really. I mean, some of these things are just, we have to do it. So I would, those types of like, sorry, we have to do this type thing, I should probably come out. And then I would also, and this is just nitpicky stuff, like instead of saying homeless vulnerable population shelters, I would say shelters for, because I think the first thing people read is what goes into their minds. So understanding that we're talking about shelters and not like the homeless issue as a whole. Mm-hmm. Because then when we come down to serving vulnerable populations, that's, you know, that's sort of, anyway. I would just kind of fine tune that type of thing. But I think as far as time up, at least 2 weeks, between 2 and 3 weeks, I think is fair. And then it's going to be critical how we get the word out that the survey is even out. So engaging media, social media, all that fun stuff.
And I am happy to take any edits. You know, if there's any, no one's going to hurt our feelings. If you want to wordsmith it, you want to tweak it a little bit. If you just want to send those back to me, that might be the most efficient. If there's something that's really substantially different, we might want to talk about it here. But if there's some wordsmithing, I think we're good. Okay. Oop, no. Okay.
Thank you. Seeing as we do have John Bunton in the back right now, and he did work on the survey for the hub survey for the police chief search. I don't know if we could bother him for just a second to ask him.
Oh, we could bother Mr. Bunton all day.
If he would just talk about how the time it was out there and just some quick input he might have.
Thank you very much for the invitation, Councilmember Sepulveda. When we did the police chief survey, I believe that we had about 2,000 responses and that the survey was up for approximately a month. It has been a little while, so I can check the stats with the hub and get you a detailed answer later today, and we'll plan on doing so.
Thank you, John.
Thank you. Just to clarify with the hub survey, it is currently active now. Is that correct?
This is not. No,
Okay.
we will get this loaded as soon as the committee is agreeable to this is the format. If there's any other like changes, send them
Okay.
to me, and then we'll load it up to the hub. It'll look a little prettier. This is, again, kind of just a little bit of a rough version, but
Do we have a deadline or a timeline for when we'd like to have it up? And then how long it will be up so that we'll know within what time frame, whether it's 6 weeks, that we'll be able to use some data? Do we know how long before we'll actually have some data?
it won't take long to have it loaded.
Okay.
So once I get back any, wordsmithing, tweaks, changes, I think we can have that up in pretty short time. And if we want to decide that we want to leave it up for 30 days, or if we want to look at it from a time frame of one of the last things I'd like to do today, hopefully before we convene, is set at least our next 3 months of meetings. So if we want to time it to where maybe we get it pulled down before our next meeting, so then we can discuss the results and actually start working on it.
Okay.
I'm going to go to Jose first and then to Councilman Sepulveda.
Yeah, I just want to reiterate that I think that, well, I'm not an expert in survey structure, but there's such a thing. And I wonder if there's anybody in y'all's world, I think there's probably someone, the researcher in MAC, like someone within the department that can do the worst meeting beyond what we can do. I understand that we can do a little bit, but it feels too loaded. It feels too wordy. It feels like too much information. And there are people that do this for a living. So I would, if there's some capacity in any of in y'all's world to craft an instrument that can produce a better results and better engagement, I would encourage us to do that. And then my question, that's a comment, the question is, so the back end of this process, what, and I know you talked about it briefly as I was walking in, but so then what? Like, what do we do with that data once it's there? How are we going to use it, and how are we going to incorporate in our decision making? Is that already said? Is that something the committee
Yes,
will
we
decide how we're going to use it later? Just a sense of what your thoughts are on that.
So what we want to do is find some of the targeted needs for our nonprofits. So if, funding for nonprofits, if serving the vulnerable populations, if some of those rise to the top of saying, these are the most important needs, then what we want to do as a committee decide, let's find our focus and then bring in those applicable nonprofits. What we've talked about would not feel effective is to just do a mass open application for all 501c3s. We just won't get the targeted effect. So let's pick, based on this community response, what we think are the priorities as we can put them together under a common program or a common umbrella, so that then nonprofits can apply to something very specific, and we're not just opening to every 501c3. So that would be the plan.
So to be clear, then this is only for to provide guidance to the allocation that would eventually go to the nonprofit partners.
Well, you can see that we're going to get more feedback than just for nonprofits, but it will help facilitate that step. What we've been funding has been a combination of internal and community. You've heard more from our internal departments, but really, if you think about it, many of the funding recommendations have served the community at large. This is just one more way to serve the community.
I guess, and maybe this is the right moment to make this comment, I guess what I would like, and it's not clear in my mind, but what I would like to this process to help us get to is, like after today, we're probably going to be about close to a third of the funds that we have available that will have been allocated, right? And so we're moving quickly. And I guess I would like to have a big picture strategy of and guide. We have the guiding principles, but maybe attach percentages or attach project. Like I would not want to get to the other side of this process and look back and have a lot of little things and having missed the opportunity, if such an opportunity exists, which I don't know, but if there's an opportunity to be looking back 5 years from now and saying, that's what this money, and point to it as wow, this would have never happened,
yeah.
Big picture things. I want this process to help us get there. And again, maybe we're just setting up the first part of the process, but.
I think that's a great point, and I think this can do that because it does encompass everything.
Okay.
So this isn't just about getting to just the nonprofits. This still has a community-wide city response, and we'll be able to see, I think, percentages, whether it's dollar buckets, percentages of the total. I think that's what this will help us get.
I think that, just personally, I feel like 3 months from now, I would personally want to be there, be pulled out from the weeds that we've been in this last few months, and then be thinking a little broader, bigger, to make more of a strategic decisions on how of the pots of money, and to the extent that this does that, that's great. Thanks for giving me the time.
Okay, Councilwoman Sepulveda, and then Gamble.
Thank you. And I just want to piggyback on what Jose said. And I agree. The hope is to get responses from the community of what they consider our priorities to be. We have the draft guide, but we haven't officially adopted the guide. because we wanted to make sure we had community input. So and today, just to be candid, I'm kind of going to be voting the way we did during CARES Act, which was hearing from multiple people about things they want to have funded and then deciding whether to fund them or not. I'd rather go back to that aspect of it until we have the hub survey complete. So we're not just funding a bunch of things here and there, like you were saying, but a big picture. And that's really how I'm approaching today until I see the hub responses. I did have a question about green space. I think, Sarah, you had mentioned that you would want to see if we could add green space to the draft guidelines. And so I don't know if we could add that into the survey, but that would be great.
Okay, I've got Councilman Gamble and then Sarah Finley.
Thank you. I just left an event, a Nashville Chamber event at the state legislature, and something, there were some business leaders, community leaders there, and something that came out as a need and a issue in our city is childcare, particularly as it relates to the workforce. There are many women in particular that are not able to get into the workforce or get back into the workforce as we deal with pandemic because of lack of access to child care, whether it's the cost of child care or just not having access to it. So I'd like if we can add child care to number 2, maybe after school programs as one of the issues that we might need to look at, or at least get feedback from the community as if it's priority and concern as we look at allocations for the community.
I will. I've noted that. I wanted to just clarify, though. Remember that one of our Fuse fellowships is looking directly at after-school programming. Now, it's a little bit focused on learning loss, but it is about access to after school. So when we talk about childcare,
Two different things.
Yeah.
So not after school, not
Okay.
school age,
you
more
were looking
younger,
at before school.
pre-K, you're right,
Yeah, okay.
before school childcare.
Okay, I've got that. I'm going to go to Sarah, and then we'll go to Councilman Johnston. Let me get your mic. Okay.
All right, I'm going to be a bit redundant here, but I think sometimes redundancy is helpful. I think it is really, really important for us to look back at the end of this process and have something enduring to show for it. There are a lot of items that I know that have been very worthwhile, particularly when it comes to public safety and comes to COVID prevention that we've approved, and that's just essential, and I understand that. But a lot of things are also just sort of things that you think could normally be in a budget that, for whatever reason, haven't been approved or included in a budget. And it's a once-in-a-lifetime thing to get this type of amount from a funder. And I read an article, I've tried to find a copy so I could share it, and I could not find it on the website, about how many other cities, and I know in the CARES Act process, we actually had looked to see what other cities did that had used significant portions of the funding to build housing for the homeless and to truly address homeless issues in their cities. And that's something that will not only help the people that are being helped today, but, you know, years from now, decades from now, it will help people that find themselves in that situation. And I would like to think that we do think big that way, and it will be very easy to spend this and then to sort of not quite remember what we spent it on if we're not careful. And I just really, really hope we keep that front of mind. Going back to Sandra's comment about green space, that's an example of an enduring asset to this city that can be enjoyed for generations to come in areas that might not have access to green space. And so I really, really think that every single meeting we need to use a filter on what we're deciding about how is this going to benefit Nashville in the long term in addition to what is it going to do to just alleviate some current budget need.
Agreed. And just to point out, your specific comment on affordable housing, at the end of today, we'll have discussed about $55 million for affordable housing. So I do think this committee will make an impact.
Yeah, and affordable housing is obviously a high priority, but I was also talking in terms of just addressing homeless population in the city as well, which is a little bit different than affordable housing.
You're set.
Thank you for saying that. I said, probably not as eloquently, but I mentioned that when we first got together for this second round of funding, that I want to be able to look back on it and see what we have done instead of sort of having it go to something that's just going to disappear. But I also want to be really careful about spending money on things that isn't sustainable. So while, and I'm not trying to point this out, but like childcare, for example, if we can't sustain that, I want to be really careful about starting something that we can't continue and finish. Not that it's totally important and necessary, and maybe we need to look at it in a different way, but that's just an example. I think there's a lot of things there's a lot of need out there, but we want to be able to, number one, look back 10 years from now and go, this is what we got out of that. What a great gift that the city continues to use, continues to see benefit from, but that also in 2 or 4 years we don't go, now what? or oh, that was a great program and now we have no way of continuing to fund it. To get back to the survey. Now that I'm looking at it, I'm seeing what you've done is taking the eligible uses and basically just line iteming them out. And I'm going to, again, repeat to her point of repetitiveness sometimes is helpful. I think the whole number 1 should just probably come out because I feel like that's part of our necessary response. Some of it maybe could, but I think the vast majority of that could come out. I think what we're really wanting to hear from the community is what's important to you and what buckets should we be focusing on? That's what I would like to hear from them. Is it serving vulnerable populations? Is it community safety? Is it affordable housing? Is it stormwater mitigation? Is it rent, mortgage, and utility relief? Is it that big chunks of things instead of getting into the weeds? Because some of it I don't even understand, to be honest with you. Like, what is a fellowship fellowships to study affordable housing? We have MDHA does that. I mean, we already have like resources for that. Like, we know what our needs are, I think. So I don't know, just some of it is a little bit redundant. And then some of it we've already done. Like we have in here HVAC, ventilation, and filtration upgrades. We voted on that last night. So that could come out just because, check, hopefully. And I'm happy to do a draft or sit down and like work with you and then bring it back to the committee and take suggestions from everyone. But I think making this very simple and 2, 3, 4 word sort of categories like affordable housing. Okay, I know what affordable housing is. Is that a priority? But wordy is a good word.
I do think the idea of eliminating what we've already funded cleans it up quite a bit. Obviously, this was the original list,
Right.
and we've been making progress. So let's take out what we've already funded. I would like to still keep some of the items in there that we haven't funded, because I do think it's important for them to weigh in. I'll say it might go a little bit to what Jose was saying. If we see something's really strong, everybody's coming back with ones, this is the most important, this is the most important, we may weight, the amount of funding, a little bit higher in that area. So I'd still like something to be measurable and quantitative, whereas I think question 2 then is open-ended and allows, for it to be more, qualitative. So, okay, I've got 2 more. All right, Councilwoman Gamble and then Sepulveda.
Thank you. And just to respond to the child care issue, the suggestion was adding child care as a bullet on this list so that the community can weigh in on that priority. And as far as sustainability for any of this, most of these allocations are capital or one-time allocations. So there's going to have to be a sustainability plan for most of this. And so the idea of not putting that on there because because there may not be a sustainability plan for it, I think the need and the desire to get community feedback outweighs that. So again, I'd like to see that added to the list for the community to weigh in on the importance of that. And also to Sarah's point about the affordable housing, we have already designated funding to the Barnes Fund, affordable housing, through the capital spending plan, through our allocations here. And I too would like to see more focus, and maybe we need to add that to the list as well, as far as well-rounded services or wraparound services for homeless, whether it's mental health services, addiction, substance abuse services, workforce development services, because those are really the root problems of homelessness in most cases. And until we address those, then just building apartments is not going to be the solution. So I'd like to see some more well-rounded wraparound services directed towards homeless in the survey and in our considerations as well.
Noted. Okay, I'm going to go to Councilwoman Sepulveda and then Vonda.
Thank you. I do agree that we need to take out what has already been funded. I do want to keep most of this because what may be a emergency priority to some isn't for others. And, you know, a lot of Section 1 covers quite a bit of that. I do want to touch on the unhoused issue. So the Homelessness Planning Council has a strategic plan. We've had it for about 3 years now, in which it has specific action items that we want to accomplish, and that could be shared with the entire committee. We met just this morning and talked further about it. And just so you all know, there is a project that has been funded to build, what's the word for it? Supportive housing. I'm blanking right now, supporting housing, that will break ground in April. Hannah, is that correct? Around April? So that is being built for anyone who was wondering. So hopefully we could break ground on that soon. But I think it would be worthwhile for us to look at the strategic plan from the Homelessness Planning Council. There might be certain items in there that we have wanted to have funded, but just haven't had the opportunity to.
All right, I'm going to go with Vonda, and then if there's not anything new, then we'll move on to the next requests. But
Mayor Joe, I just wanted to say that, you know, we wordsmithing in terms of the survey, I would like to see us do that internally, perhaps over email. But by the time we come back to the next meeting, that this has been out for a couple of weeks so that we can start the year, you know, knowing what the priorities of the community are, rather than kind of, I think we can add and take away, and even having the survey up for a longer period of time so that as we do make allocations, that the community can then weigh in based on what we've done and what they would like to see us do going forward. It just could be a guidepost and a way of communicating with what
I
we're
agree.
doing and what the community would like to see.
no, agreed. If you'll send them to me, that way we can handle it outside of, we won't go through the wordsmithing today. If you'll just send me all of that. Okay? All right. Then, looking at our funding requests, in your pre-read materials, we have MNPD. There are 3 different, 2 were in one document, CIT trainings in the third, but I think we have Deputy Chief Chris Taylor here. And Chief, if you'll come up, we'll let you, instead of everybody having to turn around, you have to come face the crowd. And I'll make sure the mic's on here. I think they're both on, but if you want, you might have to, no, you might have to click the green light on one. There's a little push button. Right here on this.
I got it. Another one I'm missing?
Right now. All right, maybe Alex, will you check?
Yep.
Okay, how about that?
Thanks, Alex.
You can sit there if you want. You don't have to stand.
I'll go right here, so I'm fine.
Thank you.
I really appreciate the opportunity to speak to y'all. Real quick, I'll kind of be respectful of your time. Anytime we're talking about ARP money, obviously we need to establish a nexus for how it would even, what we're requesting would even fit into that. So as far as for the first one, do you want me to just go down the list? Okay, yes, ma'am. The first part was with school resource officers, and it also includes our school crossing guards. And this past summer, obviously, the school system, going through everything they did, had to turn around and do a lot more summer school than what they normally do. They expanded those services quite a bit, and in turn, we increased ours. So where normally we wouldn't have SROs working in that capacity through the summer or crossing guards, we had to pull them in. The total cost was $209,000. It's directly related to the expenses the school had to use to make up for the shortfall in the education for COVID part. That, to me, that's an easy one, and I'm expecting we might have to do it again if the school needs us again this summer, so we'll certainly be available for them in that regard. But a second part, just as a general statement, on June 23rd of this year, the president came out, expanded one of the options for ARP money, which was to be for crime or gun violence. So obviously this wouldn't be one, but I will address that in some of the other ones. But as far as school crossing guard and then the school SROs, it was to supplement what the schools were doing in relation to the lost time they had with students over the previous year and a half. So good to go on the next one, Mary Jo? Okay.
Well, I guess I would
Yeah.
ask.
Yes, ma'am.
I don't know exactly how the committee wants to break it down. Sometimes they'll break down the requests into separate resolutions. So
However y'all want me
do you
to.
want to keep going, or do you want to ask questions at the end? Okay, go ahead. Let me get your mic.
A clarifying question on the SRO officers. It also has in here for charter schools. Are there currently SRO officers in charter schools, and what the percentage is from our public schools and our charter schools?
Actually, ma'am, for this one and this request, it was strictly supplementing the MNPS request. So it was the schools they asked us to go to, and it was a combination of what they did over the summer. So
Okay, so for the first time over the summer, we had SRO officers in charter schools.
the best thing to say is, ma'am, we were wherever the school system asked us to be.
Okay, and so the school board is asking, not the school board, but MNPS is asking for SRO officers in charter schools.
You're talking about for the regular school year?
Yes. This
Okay.
is for the regular school year.
No, ma'am, this is it was a supplement request we
Okay.
had from the summer. I apologize. This past summer, they asked us to step in and help because there was such a large volume of children that had to go through summer school. Normally, it would just be addressed on a kind of just a small basis. This one was so big and on such a scale, we had to turn around and pull in SROs and school crossing guards and everything else, kind of what we would do for a normal school year. Yes, ma'am?
This question is probably more for Mary Jo. Is there another source of funds for this? Because I know school systems get monies from, there's money coming in from everywhere. Is there another source of funds for this particular use?
So we did, ask
Yes, ma'am.
MNPD to reach
The
out
first
to?
request was with the Metro school system. That was declined. So,
I think they had already filed their ESSER plans with the state, and they didn't have the room in their plan. So that was the first request.
Okay.
not the best answer, I know.
Mary Jo, can you ask MMPS to send us information regarding the SRO officers, how many we have in our public schools and how many we have in our charter schools, and the source of funding for that?
Yes.
Yes, ma'am?
Oh, wait.
On the Taser 7 project, just wanted to get some clarification. There's like 5 years of just a fixed amount, and it's really unclear exactly how that number is calculated. Is it purchase of equipment? Is it training? It obviously, the purpose of it is, positive, but I just, it's a little unclear when you just sort of have a plug put in for 5 straight years at the exact same cost, just exactly what
Yes, ma'am.
we're getting for that.
Again, to go back, I want to make sure and justify to y'all the nexus for that. When we were going through the height of COVID and some of the restrictions we had, there were health orders in place. One of the things we had to do is the department was coming with protocols for how the department would address an arrest situation for someone that was COVID positive, and the nicest way to say it was trying to weaponize their COVID status. I'll just leave it at that. What we did was, in looking at best practices across the country, working with the health department and also Metro Legal, we came across the best idea was to implement a taser process. And what we did was we'd have officers in PPE prepared to handle with obviously the least amount of force we could, which was a taser. But more so than anything, what that did was that allowed us the opportunity in that window to address the person, get them restrained or however we needed to, with the least amount of possible infection, which was the goal to protect our employees and protect everybody in that time. We then took that a little bit further, and when we started talking to Taser about it, what came up, again, the first nexus is obviously we need it for COVID protocols in dealing with arrest situations. Secondarily, a big part of what we try and do, obviously, is a visual presence, and again, a big part of our use of force is warnings. It's really trying to make sure that everybody understands what's going to happen. And quite frankly, 9 times out of 10 people will, when confronted with the idea of, hey, this might happen to me, I'm not going to do that then. And they make a really good decision, so it makes it easy for us. A big part of that is tasers. Nobody wants to be tasered. So, I mean, just the easiest way to say it. So, again, in our COVID protocols, a big part of it was making sure that we gave the verbal warnings about taser usage and the fact that if you were COVID positive, that was our only option as far as the use of force at that time. Now, the next part, obviously, is, again, the president's expanding the ARP money to be used for violence and gun violence and things like that, again, opens the door for us on taser. So we feel there's a strong nexus for that part, for why this money could be used for tasers. Now, why we need the tasers. First and foremost, it's our best option for less lethal. 30 years ago, the department's less lethal option was at the height of our technology 30 years ago was an expandable metal baton. That's what we had. Now we have tasers. And during that time, we've looked at a million different options across it. Bolos, nets, all kinds of different things. The less lethal bean bags, things like that. Hands down, what we've seen over and over is that tasers are our best option. Now, getting into that, our tasers are obsolete. We were informed within this previous year that they would no longer support them as far as software. So what happened was, I give you the example of trying to run the current PCs and iPads you have on Windows 3. It's not going to work. It's impossible to. Well, that's where we're at right now. What Taser's told us is they're trying to slow the process, and they've come up with a little bit to kind of get us over the hump. But for right now, we know within a year's time, or less than a year now at this point, they're going to be completely obsolete. They won't work. Right now, we have tasers that we're having to use that are out of the factory warranty. We don't have an option. We've got to have that less lethal. So what happens is, yes, ma'am? I apologize. I thought you were rushing you quiet. We want to make sure that we give the best tools, and quite frankly, we asked Taser to look at our current shootings that we've had this year. There were 2 shootings in particular. There was one in Jolton where a woman was having a mental episode with an axe and a bat. When we deployed the Tasers, they didn't work at that time. The second one was with Officer Josh Baker when he was shot. I think everybody's seen those videos. Again, the Taser didn't do what it needed to do at that point. And the reason being is that the old model that we currently have, that's no longer, again, is going to be obsolete, has a limited range. It's not good real close, and it's not good real far away. The new Taser, because it's been redesigned, and mind you, the ones we're using right now were designed in 2003. So there's been quite a bit of, advancement since then. So the new ones have a close range that Taser, in reviewing that footage, felt both of those incidents would have probably been resolved with the Taser rather than having to use force at that time, and the force of shooting someone. So it's really, really imperative that we put our officers in the best situation, again, for less lethal. The most important thing we want to do is make sure no one gets hurt in any situation. Yes, ma'am.
Thank you. Thank you for that explanation. I was just reading down further where you go into the use of the tasers. And my question is, as it relates to COVID, do you know how often you've had to use tasers, or is there any data on how often you've had to use tasers to subdue someone who is potentially COVID positive? And also, what other type of, I know that HIV is a little bit different than COVID because COVID is airborne, but are there any techniques that you all use in regards to HIV, such as gloves or any other thing that can be used in this case with COVID? Because while I understand and agree that you need new tasers, you need the most up-to-date, best practice equipment to be most effective at your job at any time, not just during this pandemic, but at any time. Just wanting to get a little bit more information on how the pandemic has possibly exacerbated that problem, and if we might need to look at other sources of funding for the up-to-date equipment that you all need.
Yes, ma'am. Thankfully, again, I said it's the biggest part about it is obviously with de-escalation and really trying to use official presence, verbal warnings, and things like that, and letting people know. Thankfully, we had, I think it was 139 uses of force within the past year. The vast majority of that actually was Taser activations. We didn't, during the time that we were at the fairgrounds, which was, I think, what we're talking about mainly. So we only had about 3 occasions where officers had to get in full PPE, come in because there was a COVID patient that, for whatever reason, wasn't complying with what the medical staff wanted. And in none of those situations did we actually have to deploy it. Thankfully, just the presence of it and the thought of using a taser was enough. And again, going back to that nexus of why do we need this money from ARP rather than, say, 4% or something else, the new taser, and this will answer your question too, ma'am, with the contract we've got, it's a 5-year contract. We get locked into the prices for the first year that we still pay for the 5th year. So that way, that's the benefit of it. And it's set up so Taser worked with us to make sure it met the guidelines for ARP for when the money would need to be expended and when the products would come in. But a big part of it, too, is one of the things that's built into that cost that you can't take out is Taser has created virtual learning for their Taser. And obviously, that's a huge part of it and why we feel, again, it ties in with COVID. It allows us in our academy the opportunity to now do distance learning. And I know it seems kind of silly, but it's the goggles and almost looks like a video game for virtual reality. But they offer different packages, and what's fantastic is that, one, it lets us do our training off-site so that if we do get to a situation like we did during the pandemic, where we're limited in our academy staff, our academy staff, we're limited in training rooms, it lets us continue to do what we need to do to make sure people are current, that they're certified, and that new officers are brought online and using the best practices. And in addition, Taser has instituted a lot of different packages with de-escalation, not just with the Taser, but with other for use of force, community engagement, and some different ones that we can. So this model allows us, even though it's through Taser, the virtual training lets us do just about every package we want to do, and it's even more expandable as the future goes on. So that's a great part about it is we can do distance learning, which right now we don't have that capability in any shape, form, or fashion.
And one other thing, Councilmember Sepulveda get to you. It is really, I will pull up some of the subsequent guidance. There's the original interim rule, but the Biden administration actually sent out quite a statement, or I will say guidance, on really defining public safety, that we have a gun violence issue. You can probably speak to this. Gun violence issue, community safety, violence prevention. Those are all eligible expenses with these funds. So we got really good at defining really kind of very specific to COVID and the virus. But one of the intended uses of the American Rescue Plan funds really goes beyond the virus. It goes back to communities that have been, that have really been left behind, and that were just, the issues with the virus amplified the issues that were there before. And these funds can be used to address some of those long-standing issues. So and that's where we started to get into gun violence and community safety and violence prevention. So we don't necessarily have to tie it to virus or contact or virtual training. Those all exist. They're all part of this, but it also goes to more of a public safety when you define by those layers. So I will try to find that information for the committee so that you have that comfort of eligibility.
Thank you. Can I ask you if you could send data as to how many times these tasers were used in our MMPS schools and our charter schools, just so we have that as reference? Can you also let us know what other methods you all would use if the tasers weren't funded? And then just for clarification, because the tasers are over $5 million, and then for the total cost of the summer school, having the SRO officers in there, just so I understand, MMPS asked MMPD to have extra SRO officers in our public and charter schools, but then when you all requested the funds to cover that cost, they said no?
Yes, ma'am.
How does that work?
Yes.
Is a question I would have for MMPS if they could send that to us.
And I can answer the one about what are other options with tasers. We're right back where we were 30 years ago. We have a metal baton. That's it. There is no in between. And we found over and over all the different methods, and we've looked at a lot of them. We continually look at them. The shotgun bean bags are not less lethal. They're just less likely to kill somebody. But a bean bag shot at that rate, if it hits you, it's going to hurt, and there's still a likelihood of dying. So we look at the CS gas that we've had before, and it's very limited use, because if somebody's going through a psychotic episode or under certain illegal substances, it doesn't bother them at all. It doesn't faze them. I was on SWAT for a number of years. I can tell you, we went through houses after we completely gassed it to where you were on fire because of my exposure to it, and the person was perfectly content to sit there and carry on like they were. So if we don't have tasers, the only thing we've got is the baton, and that's a horrible option. I mean, I can't. When I say, and not to be overly dramatic, tasers are a life-saving device. There are countless times, countless studies. I think there's 804 studies right now by medical institutions, journals, things like that, that have said the safety of the taser versus shooting somebody. Yes, ma'am. Oh, I'm sorry. I apologize.
And then I have one more thing, because I believe during the budget cycle, we did have a conversation about removing SRO officers from our schools, and MMPS had a specific reasoning for that. So if we could get that from them as well, that would be great. They had a reason why they didn't want them out of our schools. But there was community concerns about not wanting SRO officers in our schools.
And ma'am, I'll just say again, in light of the recent 2 school shootings now that we've had, one of the most important layers of protection that we have for our school children is the relationships they have. Because what happens is when 9 times out of 10, there is some indicator that we know before about these children that end up in these shootings. What usually the drop-off is, no one's told about it. We can look at the one right there where the counselors were told and they didn't let the right people know. When you have SROs involved and kids feel comfortable, they go to those SROs, you immediately have somebody that can put into place the things that need to be done to make sure that that child gets the services they need and in turn doesn't hurt anybody. So yes, ma'am, the first layer of protection we have for the active shooter in schools is the SRO, and not in the traditional sense where you think it's them standing there with armor and a gun. It's the fact that those relationships they create with the students is untold of. That's the most important part we do. Yes, ma'am.
I just want to make sure for the viewing audience and all of us in here that these two requests are completely separate. So the tasers aren't necessarily for the schools, you know,
Yes, ma'am.
it just happens to be on the same piece of paper. So just want to make sure everybody understands that.
Correct.
Yes, sir.
For the presentation. On the taser portion of this, is this enough, this roughly $1,000 a year for 5 years, once we fill all the vacant positions and the open officer positions and then grow over the next 5 years? Does this number have to be somewhat greater or should it grow each year?
Yes, sir. This is a contract for what we have right now.
But
yes, sir. At some point, with the idea that we expand the department, yes, sir, it will need to.
And then going back to the resource officers, is this to pay for the past expenditure? Is there any need for the upcoming, you mentioned perhaps this
They
summer
haven't
we might-
requested, it hasn't been requested yet, but unless there's something to change, I would expect that it probably will be. You know,
Thanks.
I would assume, just everything I've heard, that the need for summer school is going to go on for several years to get caught back up. And I've still got to do CIT, I'm sorry.
Yeah, I was going to say.
All right. Is everybody familiar with the CIT program? All right, I know I'm terrible about acronyms. The police always are. What this is this is where we've taken counselors from the mental health co-op. They've been, after going through a 40-hour training course, and then officers, we had a group of 40 officers that also went through that training course. We have mental health professionals riding with the officers 5 days a week, and what they do is they respond to the calls for service that involve mental health episodes. Since the inception, we just have a pilot program with 2 precincts right now. They've been to about 750 calls, and the great part about that is only 4% of those calls resulted in an arrest. They were because of the mental health professional being there, because of the training the officers had in de-escalation and just in dealing with people in episodic moments like that, we were able to lower the amount of arrests. We were able to lower the amount of any times of use of force. I think 23% of those calls ended up with committals. So a lot of that is just getting people plugged into the services that maybe they wouldn't have had, and then their follow-up related to that. So it's an amazing program. Really excited about it. I hope we can continue to grow with the health department on that regard. And what we're requesting, you've got in there, is just to get us over until July. And what we want to do is the goal is to train everybody in our department in CIT training, get them certified. That's 40 hours. The mental health co-op right now can't do that. They don't have the staffing, and when we looked at outsourcing it, it was way more expensive than it would have ever been thought. So what we want to do is contract with them to embed somebody in our academy on a permanent basis. So not only are they doing the mental health, the CIT training, but also additional training in substance abuse and all the parts that we've always said for years we need to train officers up on. We're finally going to be in a position to hopefully do that, not only with our academy, but through in-service. And again, I think we've looked at it, and it's probably going to take almost 3 years at our current staffing levels to get everybody on the department CIT certified, but that's the goal, absolutely. We want to provide the best service for everybody in our community, and we feel the best way to do it. Yes, sir.
Would the $350,000 cover the EMS staff too, or would that be incremental?
No, as far for including EMS when we start, that's a little bit later phase. We've looked at, and not to confuse it because some people talk cahoots, where that's mental health professionals going with EMS, which I think at some point our city will embrace. But for right now, for us, this is just police officers and the mental health co-op going to calls together. Now, when we do the training, we are at the academy, because it's a joint academy, or hopefully it will be if y'all are good to us. But what we want to do is we want to bring in we've obviously offered it to the fire department, to EMS and everybody else, so that way they can also do this training too. Yes, ma'am?
We just got the sort of report for the first 6 months. Was it the first 6 months of what we did? And I think it showed that we
Yes,
are
ma'am.
filling a need.
Absolutely.
And that there's much more need. And so I'm in full support of this. I do think that all three of these requests need to probably be separate, just because one is related to the schools, the other is the capital, and this is really, it's to MNPD, but it's for mental health. And there's probably some questions about the taser. It's bothersome to me that MNPS requested this from you guys, but then was not willing to pay for it. Honestly, I don't know how that even happens, to be honest. So, to Council Lady Sepulveda's request, I would like to know the answer there, and to see if there is any other way to get that reimbursed before we use ARP funds. But if everybody, I don't want to cut anybody off with questions with this, the crisis intervention team training, but I'm ready here to move this forward. If everyone is in agreement with that.
I've got Junad, and then I've got
Oh,
Councilwoman
sorry.
Sepulveda. Let me get your mic. But I'm all for moving.
I just have a question about the taser. So I don't know how that relates to wanting to move the CIT forward. Forgive my lack of knowledge about this, but just curious as to in evaluating this need, if y'all, to what extent this has been part of the conversation for your regular budgetary requests that you would submit to council, as opposed to those funds coming from kind of this pot. I don't know to what extent those conversations have been had, or was this something you realized kind of in the last couple years in dealing with maybe people with COVID that the upgrade was necessary?
No, sir. Taser informed us within, I guess, probably about 9 months ago, maybe a little bit longer, that they wouldn't be supporting the current tasers anymore. So that, to be quite frank, sir, we've asked for things. I get it. There's a priority. So, and we'll ask each year. But this one, the reason it became so exigent was because they're no longer supporting the platform we have anymore, and that came up just this year. And to their, I appreciate them doing it. They've at least tried to slow walk as much as they can to help us and allow us the time to at least try to get the request in and everything else before it's completely cut off. Yes, sir. But yeah, that was why there was an exigency, was they quit doing it. Yes, ma'am.
Thank you. I think we should put off voting on anything until we get the hub survey completed. Just because I know not a whole lot of people tune into the council meetings sometimes because they're long. Last night we talked about priorities and what our priorities are, and some of the items, there were several questions whether or not they were immediate priorities. And I think we're getting to the point where there are several council members, including myself, who don't feel comfortable just continuing to vote on certain ARP funded needs here and there without having a strategic plan as to what are our priorities. And again, we have a draft guide, but we have not adopted it. And I think it's important that we start taking things a little bit slower until we have, our priorities set. So I wouldn't feel comfortable voting for anything until then, and hopefully it takes around a month. So it's not too long, but I do think we need to start considering what our priorities are.
Councilwoman Gamble?
Thank you, and actually, I appreciate my colleague, Councilmember Sepulveda, bringing that up, because I do share that sentiment that, for me, and I think as a committee, we kind of decided at the beginning that the first few proposals that we received in regards to the Metro Department's request were somewhat carryovers from the CARES Act that we weren't able to address because of the limited funds and the focus being on our emergency response. So those first few allocations, whether it was for fleet, equipment, and HVAC, were somewhat carryovers from the last round of funding that we needed to address with this round of funding first. However, I agree that we've gotten to the point now where we probably need to slow down. We made those first recommendations to address the carryover issues and wait for survey information to come in before we start making additional allocations. I think we spent, 46 million out of the first 128. I'm not sure. I think that's the number. And so we're about a third through the first deployment of funds. And so I think it is a good time and a good idea to kind of slow down a little bit, get some feedback from the community before moving forward with these new requests that are not necessarily carryovers from the last funding that we received.
Okay. Just to clarify, as of last night, we have 29 million approved. We still have 2 that were pending for 29 million.
Right, so 29 million approved, and then how much in pending?
The 20 million for affordable housing plus the 9 million for fleet, so 29.
So really
pending.
almost 50 million that we've kind of
58.
recommended. Okay.
Okay. All right. There's lots of hands. Can I do this first? Do you all want to take a vote whether you're going to vote? Because I think if we do that, we'll
And
save ourselves some time.
It's helpful to still hear these requests
we'll
or
we'll
proposals.
still
I think
hear
we need to
everybody who's
continue to
here.
hear them, but as far as
But
voting, yeah.
But I'll take it on these, I'm going to take it on these first 3, that if I can get those that would like to vote on these 3 topics, if you say aye, if you do not want to, if you are suggesting that the committee not vote on anything, on these 3 topics today, vote no. So I'm going to go ahead and open that up for a vote. Would you all like to consider these for a vote this evening? Do you want to make it all tonight, everything? Okay, so we will still listen to everything on the agenda, but there'll be no voting for any recommendations.
Pending.
Okay, we only have the affordable housing, not the fleet. Okay. I just want to, Jose, I want to make sure, chime in.
Yeah, I want to be I am the first one, I said it earlier today, to say we've got we need some higher level strategic thinking about how decisions are made. I think, however, is disrespectful to those that are here today that are on an agenda, that have an expectation of making their pitch, to not give them the benefit of a vote. I suggest that we proceed with the vote, and if the vote is no, the vote is no. Or if we individually, by each one of them, if discussing each one, need to request more information, and understand, and I say this very respectfully to the council members, you guys have a lot more information than we do, certainly than I do, right? And so, for example, I've heard enough today to vote yes on number 1 and 3 requests. You've made a compelling argument. It's unfortunate that MPS, I would like MPS to reimburse that. That's not up to us, to me, to decide. Hopefully, there's mechanisms for that to happen. Number 2, I have a lot more questions. The arguments are compelling. I hear you. I honor or respect you. I personally cannot bring myself, with the information that I have today, to support a $6 million, just because I just don't have enough information to process. And so that one I would not support today, or I would abstain. But I do think that we've got to have priorities. We've got to have allocation. but I just feel that that should have come before this moment.
Okay. Are there any?
Thank you. And I do hear what you're saying, Jose. During the CARES Act process, we did have several people come before us. We would hear them, and then later on, we would decide to fund. So I think that given the case of MMPD specifically, there is precedent for them knowing that they're just presenting and then we voting on it later on. Losing my train of thought. I did want to say that I do believe we should hear everything today, and the only items we move are the affordable housing aspects, because we did already approve that, and there is a substitute, and that's what we're hearing today, and that would be the only thing I would be comfortable on voting on. But I am just one member. It is up to the committee entirely.
Okay.
Ma'am, I'll be glad to come back if needed.
Go ahead, Councilmember Johnston.
So last night, I think what we heard from several council members, who ultimately is who decides about these allocations, is that they really sort of wanted to see more money going into the community. And how are we prioritizing that? And I totally agree with that. One of the arguments about some of these capital expenditures is that or department expenditures, is that every single department in Metro government works for the community. So we are all serving, even the people in this room right now are serving the community. If we're not going to vote on these right now, I had said, to be fair, we shouldn't vote on the others, but I'm looking at these next in line, and cure violence and community safety, and for who is for the North Nashville deal. There's the Napier-Sudicum community safety plan. There's several things that would go into the community. So I want to be cautious about saying no right now. I mean, I could argue both ways, to be honest with you, so I'm sort of torn with this. But what's on our agenda today is helpful dollars that would go directly into the community to help some of these things. So I think we just need to talk about it a little bit more.
So let me remind the committee that, you can also defer. So, I mean, maybe I just think it might be worth explaining that you don't have to vote no, as in no, we don't want to fund something. It can also be just deferred to a future meeting to rediscuss or get some of the information back. So we can make motions to defer certain of the funding requests rather than vote no. It might feel like a fine line, but there is a difference.
Yeah. I mean, to that point, when I said these three, for here we are with MNPD, and one is really a school type or related allocation, the other is a capital expenditure, and the other is really mental health. And I was ready to move on the mental health, because I don't know that anybody's going to argue that. And I think even the council at large would say, yes, this is something that has been proven that, we would like to continue and expand. And so deferring the first two and moving with the second and moving on to these other ones and hearing, I think deferring, what do you, I'm just having a hard time saying, let's not vote on anything right now. But if we are going to vote on not anything, then it needs to be across the board, not anything, to be fair.
Councilwoman Gamble?
I agree with my colleague, Councilmember Johnston. It is, and in fact, last night when there was questions about the priorities and why we're making allocations toward departmental needs and not necessarily community needs right now, it was shared the agenda for today was shared, and it was discussed that there are items on this agenda that do fit within the community service and community need. So for me, I'm comfortable addressing or maybe voting on just for today, and then maybe going forward, we be more strategic and not do any more voting until we get more information and data from the community survey. But I'm comfortable addressing the community issues as Councilmember Johnston outlined, if we want to address those today. But any other equipment and capital expenditures, maybe we should hold off on today, particularly the new ones, not the ones that are pending or the carryovers from the last CARES Act funding. So that's where I would be on that. And
Okay.
so but of course, we're at the will of the committee.
All right. Councilwoman Sepulveda, and then perhaps we need a motion.
Yes, I don't feel comfortable voting on a community need without the community input. And that's where I would be today. I would abstain on the vote, even though I agree that, you know, we do lack mental health resources. But I guess we could take a vote.
Okay.
So I'll make a motion to go ahead and vote on these, and if the vote is to defer it, that is fine. Understanding that moving forward, putting a priority on shoring up the survey, putting it out there, getting that input back, and understanding that we can defer some things, but I would move to defer the summer school, defer the tasers, and move to approve the CIT training in this particular situation.
Alex, I'm just going to make sure that we do this properly. Can we do a defer, approve in one? Or do you want to take a second?
That's
Or, I mean,
fine to make
separately?
for one motion. They can either vote it up or down on that. So, and then at that point, if that's approved, then they would vote on what they give for the other one, for the third option. So, are you voting? Is your motion to approve as requested the CIT?
Yes, sir.
Okay, so it would just be that would be approved. The other two would be deferred one meeting.
Okay, so that is the motion on the floor. Can I get a second? Okay. Any discussion? John, you look like you have a question.
As we move forward, potentially approving one, deferring the other two, when would that training start? First question. Second question is, if we ordered those tasers today, when do they come? Because one thing that struck home pretty hard, you just talked about the officer-involved shooting just recently, his taser didn't work. His second option was his service revolver, which is the worst option, the last option. When could these tasers be here if we voted today?
To answer your first question, we are planning on, as long as everything works out right, having the training for CIT begin at the academy on January. So, just in a couple weeks. And then as far as the tasers, they actually are much like everybody else suffering a little bit of supply chain drama, but they have said that because we're one of the larger departments, I mean, there's several others, but one of the larger ones, they've kind of put them aside for us with the idea that tentatively they'll hold them. We've got them till maybe the beginning of the year, if I remember right. And then also at a certain point, and I'll look to Richie or Jim, I want to say the numbers for the contract start to change a little bit. And it's understandable, but yes, sir, that the exigency there is still there. It won't go away, and we would start getting them in almost immediately.
But if we defer, our next meeting won't be until mid-January, in which case we could fall out of that line and fall to
Yes,
the
sir.
back of a line.
Oh, absolutely, yes, sir. There's no doubt about that.
So everyone knows I don't understand parliamentary procedures. I don't have the patience for them. I think the Roberts family have been ripping us all off for hundreds of years. They just came out with a new one, actually. Can we alter the motion to at least break them into 3 different votes at a minimum?
Sure.
Did I do it right?
So you're withdrawing your motion and making another motion.
Oh, wait. I gotta turn you in.
So I'm withdrawing my first motion that lumped all three together, and I'm separating them out. So the first motion would be to defer the 2021 summer school allocation of $209,100.
Motion made. Is there a second? Any discussion? Ready to vote? The motion is to defer funding for the school resource officers and crossing guards. All in favor of deferral? Any opposed? Okay, so we have all 8 that are present voting in favor of deferral.
I want to come back to the tasers because I think that Mr. Henry made a good point about supply chain and all that fun stuff. So I'm going to move to the crisis intervention team training. I move for approval as requested for $350,000 for a total of 3 years, actually 3.5 years, it looks like, of training. Move to approve.
Motion made. Second heard. Any questions? Ready to vote. All in favor of approving the CIT training, say aye. Opposed? I'm sorry, the first one I forgot to ask for abstentions. Okay. So we have 7 in favor, 0 opposed, and 1 abstention for the funding of the CIT training.
So going to the taser project, I think the tasers are, before I make my motion, I will take a little liberty. I think that obviously this is a need. We don't want outdated or non-working tasers. I think that's dangerous for everyone involved. And I think the studies show that it's the most effective to de-escalate and save lives, truly. So the question is, how is it going to be funded? If it has to be funded, we can't continue with what we have. So we're looking at a need of $5.8+ million. Are we going to long-term capital, long-term debt on taxpayers and have debt service along with it and pay for it for however many years it takes to do that? So I think that's worth some conversation within the committee before I would make any sort of motion. I don't necessarily agree with a deferral, but I understand it. So I just want to open that up for some conversation.
I will say the life expectancy of the new tasers is about 10 years, if that helps at all, as far as trying to use it for long-term capital.
And just for clarification, it would not end up as long-term capital. It would be in the 4%. Just for clarity. Sarah Finley? Oh.
Discussing this a lot, but this particular proposal I'm very torn about because obviously our police department needs them. Obviously we have crime issues in our city we want to address, and obviously we want to address them in a reasonable way. What I don't understand is there's not usually a large pool of funds out of a once-in-a-lifetime federal program available to deal with obsolescence of our police equipment. I guess I don't understand why there are not capital funds or budgetary funds available for this and why this is the right place to fund them. That's where I'm torn about it. It's not whether I'm torn over the value of this investment, and I'm still struggling to understand that.
Ma'am, I will say historically, and having been with the department 30 years, what happens is when we have those long-term, large capital needs all of a sudden like that, be it cars, radios, whatever it might be, a lot of times it doesn't get funded. It's the nature of government work, and I think we all get that. But the problem is that's a can when we keep kicking it down the road. At some point, we're like we are now with vehicles, where we're desperately short and don't have enough cars for officers. And the same thing, this one's a smaller number in relation to some of the others. I know when we redid our radio system the last time, it was, $20-30 million. We've got a record management system that we use for all of our data. It does our reporting, it does everything. It's at the end of its life expectancy. Those are usually $10 to $15 million at the minimum to start with. So I don't say it to say it's an easy answer, but yes, ma'am, I also don't fault anybody or any of the former councils on it because it's a hard decision to make. And that's why it's so, I'll be honest, when you look at money like this, it's transformational in the sense that it allows you to do some things that as a government you're not ever going to have the opportunity, at least not in our lifetime probably, where it's going to be that kind of money out. It lets us get ahead on the tasers. I'll talk about fleet later when I'm afforded the opportunity, but it's the same thing. as a city, as a department, it allows us to get past some of the obstacles that we historically always have. And it won't be a long-term perfect fix, but it will get us in a place where for at least the next 10 years on tasers, and I'll be honest, we can drag some cars out longer, that we've still got cars from 2007 that we're keeping in service. And it's that same thing. There's not an easy answer. And it's not to say, hey, it's somebody's fault because they didn't do this in the past. It's just a tough decision. I liken it to a lot of the problems we have, a lot of societal problems. It's an expensive solution, and that there's really not a cheap one about it. We don't have a better solution than tasers as far as less lethal. It's just there's no other option, and they're obsolete, so now we've got to do it. So yes, ma'am, I understand the frustration that all of a sudden we have a $6 million bill. You know, and why didn't we see this coming? Well, because, you know, we knew at some point it was coming. We've put it in budgets before, but I also understand why it's not a priority when you don't have to have it that year. It's that exigent first, long-term planning, and sometimes, you know, it's not, they don't go well together at times, I'm afraid.
I appreciate your thoughtful reply, and it's very helpful. Thank you.
I've got a little bit of a line going. So Vonda, and then Junod, and then Jose, and then Councilmember Johnston.
So I just wanted to follow up on my understanding of Sarah's question. So the allotted amount for each year is the same.
Yes,
So
ma'am.
in years 6 through 10, would we have paid for the equipment? Is it like a cell phone?
Yes,
so
ma'am.
then we would just be paying for service after that?
Yes, and actually the first 5 years are where it's everything, and then once we're done, we have the equipment the very first year, but at that point we'd have enough for everyone. We'll have replaced everything, and yes, there will be some updates, and there's always going to be secondary costs. To say the $6 million is the end of it, but it's minuscule compared to the overall $6 million, what it takes for the upgrades and software and everything else, where it's kind of like your phone. You know how you have to do an update every so often? It's the same thing. It has to calibrate how the prongs work and everything else. And so, yes, man, those costs will still be there years 6 through 10, but it pales in comparison. It's something that we can, that's the part that government usually figures out pretty well. And as a department, we do a good job planning for that and letting you know ahead of time, hey, year 6 through 10, here's what the exact cost will be. So it's just that big first-time cost that's so hurtful. And there's no other way to say it.
Nod?
I've kind of got multiple questions here. Thinking about the kind of the exigent nature of the request, and I guess my question is kind of for anybody to answer. When's the next council meeting? Okay. I guess a thought that I have on this is when I think about the functional role of government and different parts of government, this issue is one that involves questions about government contracting, because it sounds like we've got a contract negotiation going with the manufacturer. There are oversight questions. There's obviously funding questions. And I'm just curious, what does the council process look like if we approve this? Because this seems like the subject of something that if there wasn't this pot of money, there would be a council committee or some type of executive branch committee that would be reviewing this and thinking about it, and not to diminish our roles in the process, but I'd also like to think that there's we have 3 very able Metro Council members who do an awesome job, but the rest of us don't have access to the same information. And not to say that we're the ultimate people giving the approval on this, but we're kind of where it's appearing first. And so I would think that there'd be a lot more kind of government process to make sure that something's not being missed or not thought of.
So I'll let Councilmember Johnston respond to that, but just a few things. So the ways that other expenditures come through, you could have it in the CSP, which is our capital spending plan, which was voted on last night at council. It has to first be in the capital improvement budget in order to be included in a CSP. This was not anticipated at the time. It just wasn't known at the time that the CIB was approved. So even though it's now known, it couldn't be included in last night's CSP because it wasn't in the CIB. So that's a little bit of the process. The other, what we were saying, could it have been covered by 4%? We don't usually have that large of a 4% budget. That's more in our operating, I'll call it lighter capital. And it wasn't, there wasn't room in the 4% budget, so. Oop. Sorry, hold on. There you go.
So one of the things that we talked about during the budget process is putting money into the 4% fund, which is part of our operating budget. So we talk about it every single cycle. And one of the things that was brought to our attention is that our 4% fund should probably be more like a 6 or 7% fund. We have large amounts of needs. So that's where capital is sort of plugged into the operating budget, right, is the 4% fund. And so we've got a lot of capital needs. We've got a lot of, as a result of just lack of funds, but also kicking the can down the road. So now we've got a massive problem and we don't have a lot of money. So the question here really is, and it's not about policing policy either. I think we've already firmed up the policy that this is the safest way to handle de-escalation and all the different things that go underneath that. The question really boils down to, is this going to come from 4% funds or is it going to come from ARP funds? Because it has to be paid for. We can't have this technology failing. And so the 4% fund is just, it's just limited. And there's so much need there that it needs to be, again, I'll repeat it, it needs to be a bigger fund. But even if it was a bigger fund, we could wipe it out pretty quickly with other things. So this is the gift part of that, of the ARP funds, you know, in my mind is how I've sort of simplified it.
Just quickly, and I hear everyone, and I thank you for that. It gives me a better understanding of everything. I totally support using, you know, every means that we can to de-escalate situations. I feel like if we're going to talk the talk on that, we have to walk the walk on it. This is a great opportunity to do that. At the same time, I don't know. I agree that what we have been presented, I've not read chapter and verse of every study about what's the most effective de-escalation tool. Anecdotally, I believe tasers are very effective. I don't know that that is the prevailing policy opinion, and I would, you know, like someone with some oversight authority or who knows more about that than me to weigh in before final approval. But that's just my thought.
I'm gonna try to articulate my thoughts. I think the way Sarah articulated is exactly how I feel. So thank you for doing such a good job. Because my feeling, it's not about the merits of it. Your explanation today is compelling. It's I get it. I understand it. I understand when you're saying it's life changing. I connect with that. I see that, and I understand what it means to you and your colleagues. And there's this part of me thinking, but why is it up to this pot of money, right? This should have been coming. There should be another pot of money that's doing this and funding this consistently. So, but I understand this conversation is very, very helpful. And so I'm sitting here and I'm thinking, over the last couple of months, I didn't blink when I voted for vehicles and EMS trucks and Suburbans and you know, the request that high-level expenditure assets. And so why am I so difficult, right? Why is it so difficult for me to read? And it's because it's tasers. It's because you're right. But I understand. You've convinced me, and I'm ready to vote if the motion is made to approve it today.
Yes. And again, I think an important part is, like Mary Jo said, when the president expanded the use of ARP money to include us in it, so that was a big one. And I think y'all have hit on a very important governmental question, which is sometimes long-term planning is really tough when you're worried about next week. I mean.
And I think that goes back to Councilmember Johnston's reference of these funds are a gift in many ways. it can be defined in many ways. So,
And if the gift of life to one police officer, then
Thank you.
it's worth taking.
is there a motion? I have a motion to approve. Do I have a second? Any other questions? We will vote. All in favor of approving $5,880,000 for the TASER project, say aye. Anybody opposed? Any abstentions? Thank you. We have 7 in favor, 0 against, 1 abstention. You stood for a really long time. Congrats.
Would just clarify exactly, we deferred the school resource office, we approved the CIT, and we approved the tasers.
Yes.
Okay. And they're all separate, 3 separate.
3 separate resolutions, and then I will actually ask for a sponsor. Okay. And Councilmember Johnson said she would sponsor those too.
Mary Jo, can you summarize those with the votes for the viewing audience?
Yes, absolutely. So on the deferral for the crossing guards and school resource officers, that was deferred, 8 in favor, 0 against. For the CIT training, that was voted in favor. We had 7 in favor, 0 against, 1 abstention, which was Councilwoman Sepulveda. And the TASER project was approved, and that was 7 in favor, 0 against, 1 abstention, Councilwoman Sepulveda. Okay. Make sure I go by. All right, so now we have John Bunton and Dia Cirillo from the mayor's office for community safety requests. Or John and whoever comes up. Sorry, you may have to do some introductions for us.
And having the pleasure of engaging with Tim Polston via email. Tim Polston? I think he forwarded an email to Ashley.
We'll try him again. I'm going to turn them all on.
Delightful guy. I don't know if you read the thread.
I didn't. Basically, I saw it. I was like, Ashley sent me. He's like,
John, I feel you may have to.
I was like,
There's that.
Hopefully nothing.
See if you can.
Yes, I kind of stayed away from it.
Oh, wow, yeah, she's good interacting with him. He's basically like, planning shouldn't have any say in any.
Good afternoon, everyone. Can you hear me? Yep. Great. I'm John Bunton, Director of Community Safety. It's a privilege to be here before all of you today to present these 2 urgent requests, both of which were formulated with a great deal of community input. I want to introduce the other people here with me today. To my immediate left is Jamaica Usher. Ms. Usher is the president of the Sudicum Resident Association. To Jamaica's left is Amanda Thomas. Amanda is MDHA's Community Safety Coordinator for Napier Sudicum. And to my right is Ron Johnson, Metro's Community Safety Coordinator. As you've all heard, COVID has had a major impact on gun violence in cities across the country, including, unfortunately, Nashville. Last year, homicides in Nashville increased by over 30%. This year, there's a much smaller increase. It's up about 4% year to date. Napier Sudicum in particular has seen a sharp increase in the severity of gun violence. And that nationwide increase in gun violence is exactly why the Biden administration has clarified, as Chief Taylor mentioned, that gun prevention initiatives, investments in community solutions to violence are very much encouraged under the ARP. So we're grateful to have the opportunity to present several requests to each of you. I promised Amanda that I would not talk for too long. I want to turn this over to Ms. Usher. She's going to talk a little bit about the process that we utilize to identify needs and priorities. Jamaica, over to you.
I don't think it's It's working. Can you all hear me? Okay, awesome. Hello, everyone. Good evening. As John said, my name is Jamaica Usher, and I am a resident of Napier Sudicum Homes, and I am also the Resident Association President for Sudicum Apartments, which is the liaison between the residents and MDHA. Sudicum Apartments is the second largest family property that MDHA supervises, and Casey Homes is the first. And so I'm originally from Alabama, but I made my transition to Tennessee back in October of '97. And I moved to Nashville in 2000, where I received my first apartment in Sudicum. So I've been a part of that community for 21 years. My oldest child is 21. So I've been a part of that community for quite some time. And I have 4 children. I have 3 girls and I have 1 boy. And I've raised and currently still am raising my children in that community. So I would like to take this time to express my experiences when it comes to the safety and changes that the community has endured during the pandemic. This community has suffered tremendously from decrease of social services, which are resources, trouble having access to food and other essentials, basically a food desert, and also shots being fired or other violent crimes that have taken place in the community, and also traffic calming. Like I stated, I've been in that community for over 21 years, and I've seen many resources pull out, such as Metro Juvenile Court truancy offices, Street Works, Department of Human Services, the WIC program, which is for women, infant, and children, the Martha O'Brien and Second Harvest Food Banks, and the list just goes on. And a lot of these resources pull out because they're concerned for their safety and for their partner safety, for their worker safety. And so it's really hard for that community to sustain or have stability when it comes to the necessary accommodations that we need, that we require. My community, we have a number of quick marts and gas stations, but we don't have a grocery store with fresh fruit, vegetables, and a meat department. The residents have to travel miles away to shop. Yes, we do have a Dollar General store there, but the shelves can never stay stocked because it's such a high demand, and everyone needs things out of that one store. So they can't keep up with the high demand. And so if you don't have a vehicle or bus fare, then you can't get to the store. That's the only store that we have in the community. So now I want to discuss with you guys the safety issues that we have had in the neighborhood. And I'm pretty sure you all saw on the news just last night that there was a shooting and someone was found deceased in the alleyway, which is necessarily not on Tony Sudicum or J.C. Napier property, but it's still within the community. And so that's something that we endure on a daily basis. We have shootings that take place, if not twice a week, maybe 3 times a week. And it's gotten to the point where our children are immune to it. They hear the sirens, they see the police, they see the ambulances, and they're like, oh, okay, someone got shot. And that's not normal. That shouldn't be a part of children's everyday routine, everyday society. It's just not. But we have families that play outside in the yard with their children, or they sit on the porch and congregate with their neighbors, and then all of a sudden you're grabbing, you're snatching, you're running or falling to the ground because you're trying to protect your loved ones or strangers from stray bullets. Bullets don't have eyes on them. They don't. And so they're going to hit whoever's out there. And that happens a lot. And this is what I've experienced with my loved ones and with strangers in the community as well. And witnessing individuals on the streets, inside apartments, in parked cars, or they're even on the playground and they're dealing drugs, they're using drugs, and it's just very unfortunate. It's sad. It's very sad. And the goal is to avoid being the victim of shooting incidents, which can result in your personal property being vandalized, aggravated assaults, robberies, sex crimes, domestic violence, and riots, which are fights. That takes place in the community a lot as well. And it's unfortunate because, for whatever reason, our community, they look at the Metro Police Department as a joke. They don't take them seriously. And we need some assistance in that neighborhood very badly. And so we're hoping that with us presenting and applying for this grant, that we can receive the funding that we need to bring more resources in the community. And so we also have the community center. So our community center, which is Napier Community Center, and they share the gymnasium with Napier Enhanced Options Elementary School. That gymnasium, that community center has never been renovated since my daughter started pre-K. It looks the same, not even a fresh coat of paint. And there is a dire need for renovations for that community center. Now, it's unfortunate that only the regional community centers get renovated, get the upgrades they need, but not the neighborhood community centers. We have an Olympic-sized swimming pool that's in that center, and our neighborhood, our children can't even use it because it's not functioning. It's so many repairs that need to be done to that pool, and we can't use it. We can't use it throughout the year. We can't use it for summer camp. It's just there, and it's rotting. It's going down. And so I thought that maybe with the Napier Metro Park sharing that gymnasium with a metro school, that center would have probably been one of the first centers to be renovated. But that wasn't the case. Like I said, it's never been renovated. And so that community center can be a safe haven for the community, for the adults, especially for the children. But the children don't even know that the community center is there and that it's still fully functioning because it's not advertised. It's not advertised. It's not presentable. It doesn't have a welcoming feel to it. And that needs to change. So MDHA's Napier and Suticum Apartments has a total of 821 units combined between the two, and an estimated figure of about 1,000 youth there. We have 1,000 children in that community. We have more children there than we do adults. And one city street divides both complexes, which is Charles E. Davis Boulevard. Charles E. Davis was born and raised out there in the Suticum and Napier area and attended Vanderbilt University, where he played basketball and went on to further his career in basketball and had a street named after him. And this street is the one street that divides both communities. This street is 55 feet wide, and that's not even including the sidewalks. That's just the street itself. And on that street, we have the Pruitt Library, we have Neighborhood Clinic, and we have MTA bus stops. And not to mention our children, they sit on that street and wait to be picked up for the buses for their schools. And we have so many schools that come in that area, and so it's different locations where the children are picked up at. So it's important for us that we also have traffic calming in that area. We no longer have crossing guards because of funding. They took away our crossing guards. And so myself and other parents, we get together every morning and we make sure that we're outside on the streets to make sure those kids can cross the street safely to get to their destination if a lot of the children don't ride the bus. And a lot of our children, they walk down to the elementary school if they miss the bus or if the parents decide they want to walk them. And so on that street by itself, I've seen drag races, I've seen the dirt bikes, the ATVs perform up and down. I've seen personal vehicles get damaged by bullets, by gunfire. I've seen my gosh, it's just a number of things that takes place on that one street. It's a bit overwhelming. But the point is, we need traffic calming in that area. We deserve to have crosswalks. We deserve to have speed bumps put there to eliminate a lot of that speed. And like I said, with all of those three necessary buildings that are there, like the clinic and the library and the bus stops, the MTA bus stops, we need that there on that street. And so I feel like this grant is important because the community needs change. We need change. And in order for us to change the mindset, we have to show the community, the residents, that someone cares in the area, that the government cares, that the city cares. We have to show them that someone cares. And if we receive this grant, it can open up so many more doors and opportunities for that neighborhood. But me personally, I feel like that area is going to continue to be overlooked and neglected unless gentrification starts. But we can't wait for gentrification. We need assistance now. And I hope that you all look at the proposal and you all take into consideration of voting, for this grant for us. Thank you.
Thank you so much, Jamika. I could say a little bit more about the process and some of the other things that we've done to support this request, if the committee would entertain a quick update.
Sure, go ahead.
I also want to acknowledge the work and support that Councilmember O'Connell has provided, as well as Dr. White. They've been fantastic and integral partners in all of this. Several months ago, MDHA reached out to us for a request for assistance, and it's been an incredible privilege for me and for Ron to have a chance to work with Ms. Usher and Mr. Mooney over at Napier. And we had a series of meetings, ably facilitated by the wonderful Amanda Thomas. And in very quick order, we identified a couple of priorities. One was Charles E. Davis, the traffic situation there. One was lighting. One was the condition of the rec center. And we've worked very hard to address those needs. This month, NDOT is going to be doing traffic calming on Charles E. Davis. The 35 lights that were chronically out were quickly repaired by NES. The capital spending plan that was passed last night includes $500,000 to restore the pool at the Napier Rec Center and to upgrade it so that it can be operated year-round. Parks has made a commitment to program it year-round, to provide lifeguard training and offer employment opportunities to people who complete that. The police department and Parks have also made contributions to upgrade the community center and to do more around community engagement. This specific request for $300,000 does a couple of things. One is it provides additional funds for the rec center. It provides funding for programming for Dr. Kinzunza, who runs the Pruitt Branch Library. And it also provides funding for, and is a significant vote of support for, the community engagement efforts of MMPD. It'll allow them to get bikes and also provide bikes to kids in the neighborhood. There's another component, which is $200,000 in grant funding to run through the Community Safety Partnership Fund. I want to acknowledge my colleague in the back, Dia Cirillo, Senior Policy Advisor. Dia has been working to craft an overall strategic framework with our wonderful Community Safety Partnership Advisory Board. And in many ways, this model, which Ms. Usher, Amanda, and other participants in this process have developed, is, I think, a guideline for us. It'll be something we'll be discussing on Monday, Councilmember Gamble. There are priority areas where we need to support more services. Amanda has identified 18 nonprofits working in Napier-Sudicum. Most residents don't know about those. We need to do a better job of sharing what resources are there. We need to provide additional resources in priority areas, which, based on discussions, could be things like out-of-school activities, culturally competent therapy, employment services. And we're very hopeful that you'll consider this request, and it's my intention to suggest to the Community Safety Partnership Fund that we match this request early next year, thus providing an even more significant investment to the community, in addition to the investments that council and metro departments have made. Thank you very much. Happy to answer any questions.
I'm glad you updated that, because I was looking, so we've got these, the Napier and Sudicum is sort of in conjunction with the other, and it was just shocking to me. Is like Casey Place is at 13.3 million and Cumberland View at 1.7, and then Napier 300,000. I was like, what are we doing? So what, how much, you said the traffic calming, because that is huge. and the lighting and all of that, what's the dollar amount that is being invested into Napier Place and Sudicum Apartments through those different funding sources that you just talked about a moment ago?
The cost of the traffic calming was approximately $50,000, and NDOT has a fund which it's using for that and has committed to doing that this month. The capital spending plan provided $500,000 to renovate the pool and to add a heater so it can be used year-round. Lighting was simply a matter of getting NES to prioritize and make those repairs quickly. I think they did so within 2 days of that being identified as a priority, which was extremely welcome by residents. The police department agreed to increase its community engagement funding by about $50,000. Parks agreed to put $20,000, make it available for the rec center immediately. And so those are the specific contributions for those elements. There could be additional requests coming from other directions, but we really wanted to work with people who live in the community or work there on a daily basis. And we wanted to demonstrate that we could quickly identify priorities and solve some problems.
Okay, so we're close to that amount with the Cumberland View. I just wanted to make sure, it was such a disparity between the amounts that you're asking for. I just want to make sure that we're not leaving them further behind. Can you tell me the size, just put it into perspective in my head, the size of these three? So Casey, Cumberland, and then the Napier Sudicum, which I think Napier and Sudicum is 2, right? Yeah. Can you just, so I can put it in my brain, how big these are?
Amanda, do you want to field that question?
I can speak to it slightly. I know that Sudicum Apartments is the second largest family property, so it would be right underneath Casey. And if you add Napier, I'm sure that would be above Cumberland View, because Cumberland View is a little bit smaller. So it would be, well, honestly, with Napier and Sudicum combined, they would be larger than Casey.
Okay.
So.
Okay, and so the $13.3 million ask for Casey, is that just massive deferred maintenance that, because we're going from 1 or 2 million to 13.3 with Casey Place?
To speak to that request, Councilmember, I would defer to Matt Wiltshire and others at MDHA. They would be better positioned to speak to the comparative request.
Okay. I personally have no issue with this. I mean, I think this is what this money is for, honestly, and that it's going to truly make a difference in your life and your family's life and your neighbors. This is great. I'll just leave it to the committee, but I just wanted to make sure that we were balancing everything. Thank you. And thank you for being here.
And if I could add something, I just want to put a little bit of context. So I'm the community safety coordinator. I'm also coordinating a community safety and crime reduction plan in Napier and Sudicum with a value of $1 million as well, contributed by MDHA. And the whole point of all of this is that I'm amplifying voices and connecting partners. And through that amplification, we were able to get some of these needs that have been delayed for some time noticed. So there will be some other things that come along, and I'm sure there's other plans, but the reason why I'm specifically here is just because a part of my job is just making sure that we're connected to resources and we address things, and through that information got out about the need. Because all these resources were pulling out, so there were less foots and eyes on the ground, and me being there, I was able to amplify those voices, and that's why I'm here. But I'm sure there's other things in the works for the properties.
Thank you. And thank you for being here. Can you quickly just summarize the item and the ask amount for everyone? Or I could go ahead and read it.
No, of course, I'll attempt, and anyone correct me if I contradict the memo. So of the $300,000 request, $200,000 would be for nonprofits currently working in the Napier-Sudicum area. So we'd be looking at that pool of 18 nonprofits that Amanda has identified.
I think it was 210.
Oh, no, it's been adjusted.
Yeah. And then 60,000 would go to the rec center, which obviously, in conjunction with the CSP investment, we're making a major effort to breathe life into and to make it a hub of community activities. And then the working group and the membership is in Exhibit A of that memo. Also requested $30,000 for police community engagement efforts and $10,000 to allow Dr. Kinzunza, the branch librarian at the Pruitt branch, to upgrade some offerings and try to attract more kids to a supervised environment.
Thank you. I'm struggling with this because I want to vote for it, but then I meant what I said about wanting community input. So I do want to vote for it tonight. I guess now it's what it is. But
I actually can.
I
mean, it's.
I
Can you
know.
hear me? I'm so sorry. I want to speak to that. It's so timely that we're here tonight. I love that you all are prioritizing community engagement. As a piece of the grant that I'm working on, is the BCJI grant. It does require community engagement and being evidence-based and data-driven. So I have spent about the last 9 months doing focus groups, a community survey. We got over 500 responses. We've been looking at data with uniform crime reports, calls for service. We've also been doing site-based community engagement events. So we did a youth summer camp series in the month of July, where we collected feedback from young people about their needs and what they see in the community to get amplify youth voice. We also did community conversations all the month of October for every Monday, every week of that month. And we did a fall break camp where we had a youth summit where we talked with youth about their needs and what they wanted to see in the community center and their community. So we've been doing a lot of community engagement, the formalized kind like your surveys, but honestly this community has been surveyed to death. So we love to have conversations. We also have been doing community dot exercises, which have been amazing because there is that literacy gap to consider. So we will set up at management offices or events, and we've been asking community members to identify what populations they feel like need the most attention, what kind of interventions they would like us to implement, and also, what age groups they feel like need the support. And we categorize those by seniors, adults, and young adults under the age of 18. So it's been very eye-opening to see, and all of that has been guided by this. I also facilitate community safety meetings on the first Wednesday of every month, where I've been taking this information from this work group and getting their feedback and bringing it back to John and the group. So this has been heavily influenced.
that was my second question: is how was the community reached out to? With all that being said, I'll make an exception tonight and go ahead and vote for this. I do ask for all that you just said of how the community was reached out to be included with the legislation. That would be helpful. And with that's all I got.
Thank you. Thank you for giving that in-depth, comprehensive view of all of the community engagement. In fact, I feel like what you all have done is 20 times more than we would get from this hub survey, because the people that you are talking to directly are not going to that hub survey to provide input. So thank you so much for providing that information. I do serve on the Community Safety Partnership Fund, so I feel like you all preaching to the choir to me. This is what we need. I've been involved and privy to discussions with John, with Ron, and know that this is something that we need to support. So definitely I will be supporting this, and this does fall in the category of community support, and for that I hope that the community shares that sentiment. Thank you.
Just a quick comment. First of all, Ms. Usher, thank you for your compelling presentation. I'm also a native of Alabama that relocated here, so I find a lot of, I'm impressed by the amount of community engagement in this whole proposal. I do notice that there are a number of different types of expenditures. I think for purposes of the nonprofit monies, the working group is going to be overseeing applications that come in through Hub. But in terms of who's going to be sort of accountable for the oversight of making sure that the other monies are spent and that the bang for the buck is actually realized, because that was a little unclear to me beyond that application process for nonprofits.
I'm so glad that you asked that question. That actually speaks in part to our next request. The working group had accepted the suggestion that we put an application out on the Hub and that the funding be dispersed through the Community Safety Partnership Fund. And in our next request, there will be a request for funding to hire a program manager to assist Ron, our community safety coordinator, Dia, and myself with the project management and the contract administration responsibilities that come with making grants to nonprofits. The finance department has provided very clear guidance about reporting requirements, as has legal. Mary Jo has put up with more questions from me, as have members of her team, than anyone should have to. So we are in the process, and we're hoping you'll support a request that will allow us to fund a position which will be able to do that full time. Because one of the things that we, have learned as we're working with grassroots community groups is many of them are new to this business, and they need support. They need someone who can work with them and help them get through the requirements.
Sean, I think she was speaking to the library, like how.
Oh, goodness, and Amanda tells me I didn't answer the question. Was the question about funding for the community center and the library?
Yeah, these particular amounts, just like I said, most of them seem like they will be handled through that application process, but then there are other amounts that are going to be allocated to the various other services, but it's not really clear who's actually overseeing the purchases and the implementation.
So, with for the CSP funding that will go to the Napier Rec Center and pool restoration, that'll be handled just like any other capital expenditure through Parks. And our office will be working with Parks and with the library to ensure that the $60,000 that goes to Parks does indeed make its way into the Napier Rec Center. I'm responsible. Yes, ma'am. And
that's really helpful.
And I can say that I have a very strong accountability group.
All right, go ahead, Sean.
One, just thanks for being here, for getting all the community input. I think you should run our survey, by the way, because you did a much better job than we're going to do in interpreting it and getting to the need. I asked this for most expenditures, though. It don't seem like enough to me. Is this enough money to take advantage of the capital improvements and what you're going to do to keep them as designed almost immediately? It just seems as if we're building a plan that will have some natural deterioration immediately, and we're going to be sitting in the same place 2 or 3 years from now where there's no funding to make sure that all this investment is taken care of. So should we amend this $300,000 by X amount to make sure that we can have continued investment and making things better every day, and it's not just the one shot? And I would trust you would oversee that as well.
That's a difficult question for me to answer, of course.
No, it's not. It's an easy answer. Say, yes, we need $60,000 more.
What I would say is this is, of course, a community with great needs. I think I certainly recognize that. At the same time, this is an area where we have made significant investments and we're trying something new. I do believe that doing a round of funding for community groups working in Napier-Sudicum, particularly if the Community Safety Partnership Fund chooses to match the $200,000 with another $200,000 or even a $300,000 grant, will be quite significant. And one of the things that we all need to do better is we need to coordinate our activities better. I think there are opportunities to work with some of the other nonprofits in the neighborhood to try to get people re-enrolled in Medicaid. So I feel very good about, the number of resources that we're bringing to this area initially, but of course it is an area with great need.
Just two things. The initial proposal, I think, was 210,000 for the grants. Is there any need to put that 10,000 back in there and before I make a motion?
You certainly could, Councilmember Gamble. The working group decided to put a motion to the group to allocate 10,000 to the library. So that's where it went from 210 to 200.
Okay.
Dr. Kinzunza had some things he wanted to do with that.
Oh.
So that just explains that shift.
Okay. Great. Thank you. In that regard, then I'd like to make a motion that we approve the request for $300,000 for the Napier-Sudacum Community Safety Plan.
I hear a motion and a second. Any other discussion? All right, time to vote. All in favor of the approval of 300,000, say aye. Any opposed? Any abstentions? All right, 2, 4. So that gives us to 7 in favor, 0 against, 0 abstentions.
We did it.
Gamble? Is that correct, Councilwoman Gamble? Is that what you said? Thank you. Oh, sorry.
So this is all sort of related, and I'm glad we have just allocated the 300 there. So the Casey Place, there's a lot of money in here going toward water and sewer. There's no question there's the need there, but typically water and, yeah.
That's the next MDHA request.
Oh, y'all aren't doing that? Oh, sorry. Okay then, thank you.
Sorry, not to cut you short. Not that there's anything short about this.
Oh, they
meeting,
do have
but
cure violence. Okay,
do have
I'll
cure
just come
violence.
back to this. I'll just try to remember my question about the other one. Okay, sorry.
Thank you.
I'm just going to say thank you to the committee and thank you to you guys for being here. You're free. Ron and I will stay and make the next presentation.
Oh, it's over. We did it. Oh, okay.
Success.
Thank you.
Thank you for being here.
Thank you guys so much. And we all go downstairs and get.
There's some right there. Right there. No, hand at your fingertips. Looking.
Thank you.
You'll just sign names. Just put their names on it. No.
Let's turn to cure violence. Thank you all for allowing me to speak to that. I will save you all the comments about COVID, gun violence, and the Biden administration's plans. And I just want to provide a little bit of context on this request. So a year ago, a 41-person policing policy commission convened by Mayor Cooper and representing a very diverse section of the city met to talk about how we as a community could improve public safety. One of the recommendations that came out of that group, which was really championed by Sharon Roberson, YWCA president, who is now the chair of the Community Safety Partnership Fund Advisory Board, was that we as a community need to invest not just in public safety, that is critically important. We are committed to investing and growing that investment, but also community safety, specifically in grassroots groups who have been doing life-saving work for many years without, in many instances, much recognition or support at all. Council and the mayor set aside $2 million for a community safety partnership fund using governor's grant dollars. That allowed us to hire my wonderful colleague, Ron Johnson, Metro's community safety coordinator. It allowed us to start the community safety partnership fund, which we've already touched on. At the same time, in the last budget, council also set aside $1 million for a cure violence pilot in North Nashville to be administered by the Community Safety Partnership Fund. Our advisory board, it's an incredible privilege to work with the folks on it. Our chair, Mr. Roberson, is remarkable. Councilmember Gamble and now Councilmember Evans have been wonderful additions. It also includes Tanae Franklin, the head of the Board of Health, Christian Buggs, the head of the school board, Katina Beard, the head of the Mayor's Behavioral Health and Wellness Commission, the head of the New American Advisory Public Safety Committee, and so forth. It's a very high-powered and engaged group of people. They asked us, the mayor's staff, to identify best practices in this area, and we identified 3. First, this is a pilot, there needs to be an evaluation. Second, this is very hard, challenging work. Places who have done this for some time and done it well, cities like Los Angeles, Chicago, and New York, provide intensive training and ongoing professional development and support. And third, this is a profession with professional standards. There need to be very clear rules which everyone follows. Another thing that we heard as we talked with community groups in other cities, academic experts, Biden administration officials, advisors to Nashville groups, ex-government officials, was to do this pilot correctly, it needs to run for a minimum of 18 months and ideally 2 years. We also heard that we know that council's intention here was to support nonprofits working in this area. It is absolutely the right thing to do to evaluate these efforts and to train people doing this work, but we also did not want community groups who were doing this vital work to lack resources as a result of our decision to properly do this process. So as we look forward to posting the application for the Cure Violence pilot before the holidays in the next 2 weeks, the advisory board is reviewing a draft application and also an RFP for evaluation, which Dr. Peter Valier from the COB, Tia Cirillo, my colleague, Dr. Chairs at TSU are working on, as well as an RFP for training. We realize that to do this right, we need to go back to council and ask for an additional $750,000 that will allow us to run this as a 2-year pilot. That is the first request. There are also requests for hiring a program coordinator to help Ron manage relationships and manage these contracts for 2 to 3 years. As well as a request to support a newer initiative, which we're very excited about, which is trying to really understand the nature of gun violence in Nashville and start to have conversations with folks who are most involved with it as we work to keep them safe, alive, and free. And Ron, do you want to talk a little bit about your need for assistance and what you're thinking about that $240,000 and $70,000 request?
Well, when you think about this type of work, groups don't care nothing about how much you know until they really know how much you care. Those are just the bottom line. So I think doing this type of work and bringing someone on is going to be very important for that person to actually be the person that we truly need that can really exemplify what that work looks like. And so that person that we're looking to bring on will take on the application process and looking it over and making absolutely sure that it's done correctly. Continue to help build those relationships with those nonprofits who are doing the work, because when you think of what we are trying to do here is we're trying to build a runway, the plane, the engine, and everything all at the same time, and trying to break through and addressing this work on the front line while it's actually going on. And so this is not going to be an easy task, but I think it's a doable task with the right people in place to make it happen.
So I'm happy to say a lot more about each component of this request, but would also welcome the chance to answer any questions that you have. Yes, ma'am.
how is the community reached out to? Is it just through the Community Safety Partnership Advisory Board?
So there are a couple of different answers to that question. Let me speak first to sort of the Cure Violence Initiative. That is something where the council unanimously approved moving forward with that approach. And what we're simply seeking to do with this request is have the funding to run it for a full 2-year period with, training and an evaluation component. We are hoping to post the application. In fact, we will be posting the application before the holidays, as well as putting out RFPs for training and an RFP for evaluation. And we're very hopeful that this group will approve this request so that as we move forward with the application, we can make it clear that this will be a 2-year pilot. And that is, I think, something that everyone that we've spoken to agrees is the appropriate time. We want this to work, and we want to be doing everything we can to reduce gun violence. Every evidence-based approach that the community supports, that's what we want to do. And so I think there's a strong sense and across the council that we need to move forward with this. We just want to do it right. In terms of the sort of way the community safety partnership works, what we're trying to do there is to reach the relevant communities. Ron has done key outreach there. It's something that we are working on. The next meeting of the advisory board is going to be Monday, and a recommendation that I'll be making to the group is that we consider a round of funding to support what's happening in Napier-Sudicum, where there's been a really robust community engagement effort. Muhammad in our office has also identified Southeast Nashville as an area where there are specific needs among new American communities. He's recommended that we do a round of opportunity grants, specifically focused in Southeast. And I think that's a wonderful idea. We'll be taking it to the advisory board, and Ron and Muhammad will work to let groups know about this opportunity if the advisory board endorses that course of action.
Councilmember Gamble, and then we'll go to Sarah.
Thank you, Ron, for breaking that down for us. And I just want to reiterate that the council, when we approved the allocation of $1 million in our budget to support the Cure Violence and Community Safety model as a way to reduce gun violence in our community, this just further supports that initiative to work with community organizations, mentoring groups, to support their work in collaboration with Metro to address violence. So this allocation, as it's been expressed, will allow us to do that on a 2-year pilot instead of a 1-year pilot. The $1 million that the council approved in our budget really would only sustain us for 1 year, and all studies and research show that you need a minimum of 2 years to really get results with this type of program. So for those reasons, we are the Community Safety Partnership Fund or committee rather agreed that we needed to look at additional funding to support a 2-year pilot, and the idea of coming to the COVID-19 Financial Oversight Committee for that funding was, in my opinion, a great idea because this type of allocation fits within the criteria of those funds. It supports the Metro Council and cities' desire to look at other ways besides just our law enforcement to look at reducing violence and crime in our communities, and that's what this does. So we really, should seriously consider supporting this work so that the 1-year allocation is not just wasted. We really need at least 2 years to do that. So that's what I have to say. Thank you.
Sarah Finley?
A couple of quick questions on the final two items on the list. The project manager expenditure, which seems like a fairly substantial amount for 2 to 3 years of oversight. Is the intention, for that to become a Metro employee? Is the intention for that to be outsourced to a contract person, or how does that look?
So my intention is absolutely for that to be a Metro employee, and we're currently at the point where council approved 21 contracts to nonprofits. One of the strategic issues that we're going to have to deal with is what's the right number of grants to have outstanding. Just as a case in point, there are other entities. I'm thinking just of NASA, because that's another place where I've been working with our Fuse Corps fellow on identifying out-of-school activities. I believe they have 18 contracts and 2 contract administrators. So we're asking for funding to support the growth in this area. My recommendation to the committee will be doing a round of larger implementation grants in Napier Suticum and a round of opportunity grants in Southeast. And these, what we've learned from the first round is we've really got to be there with some of these groups to help them, meet the paperwork requirements. It's a get on the phone, get on Zoom, come by the office. We're going to help you do everything. And simply looking for the resources to support this work going forward. It's absolutely my sense that we're, in a larger sense, we're expanding the definition of public safety. We're talking more about community safety, and that these community investments and community partnerships are absolutely the right way for Metro to move. And Ron, Dia, and I, as well as partners like Anthony Johnson over at the Health Department and others, we want to make a success of this so that council will look favorably upon future requests.
John, I think maybe the question was, is that one position for 3 years? So I think it probably breaks down to, I don't want to put words in your mouth, roughly 60, because about $60,000 annual salary, because by the time you load it with benefits.
Yes, that's correct.
A Metro employee making $60,000 a year plus benefits.
Yes, ma'am.
And then the second question is, I know it's a relatively modest amount of money compared to the first two, but the description of the third makes it sound like $70,000 to facilitate a meeting. And that seems, a little odd to me.
Yes, ma'am. I appreciate your flagging that. I can assure you we will not pay anyone $70,000 to facilitate a meeting. Let me speak a little bit about this. So I'm someone who's known as a cheapskate, and this is a story of cheapness and also efficiency. So we're currently in the process. Later this month, Metro is going to be doing its first comprehensive deep dive into data around fatal and non-fatal gun injuries in Nashville, Davidson County. We're very fortunate. Every Town for Gun Safety, which is a large national nonprofit that works in this space, has agreed to support a research team based at the John Jay College of Criminal Justice, the National Network of Safe Communities, to come in and work with Metro agencies, the police department, DA's office, federal partners, and really try to understand, look at every single gun injury or death and say, what's happening here? This is a sort of approach called a group violence intervention. It's commonplace across the country, and they're also working in Memphis. I think Memphis is paying, I believe, over $300,000 for this technical assistance. Every town has just made this available to us because they're already working in Tennessee. And what we hope to learn from this is a much better understanding of, who is involved in gun violence and where. And as we sort of build what Ron likes to call the village, what we're hoping to do is to, I'll let you talk about it, Ron.
Well, what we're really hoping to do, can you guys hear me? Okay. What we're hoping to do is really build a village of messengers, because when you think about violence, there's someone who knows someone that's committing the violence. It's sort of like the AVB program that I did with a doctor back some years ago with Vanderbilt, the aggressor, victims, and bystanders. Someone knows who that person is, and they're out there. So why don't we go and find those people who are out there that has a relationship with that person to help us help them? And so we liken it to, how can we help you? Because no one wants to be shot at. Let's just be real. No one wants to be shot. So therefore, if we can put someone in that person's face, in that person's space that knows them, I think they'll be in a better position to help them. But they'll be a little bit more equipped because they would have come to some of the trainings, some of the meetings that we will have that's going to give them some of the tools that they will need to have that conversation. It won't be just a conversation of just, man, you don't need to do that. You know, they have some strategic things that they could say that would trigger some things that we know technically in their brains and all of that. You know, they'll have some things that we're hoping to help them with CBT, you know, what that looks like, how you can help them with it, how we may be able to get some of those messengers CBT trained. All of those things are things that we're hoping to introduce those messengers to help along the way, along with John Jay and what have you, as we go forward.
So our goal, just to say a little bit more about this, and this is all just happening now, is we don't want to just get a problem analysis on paper that doesn't engage with community groups that we've started to support. About 2 weeks ago, Ron and Don Stone over at the Center for Nonprofit Management had the first meeting of our group of grantees. And it was just really powerful to see everyone together in the same room talking about what they were doing, learning from each other. We have not gone down the path of engaging technical assistance at great expense from John Jay. We've relied on Everytown and basically sort of asked for their support and help as part of this process. So what we're hoping with the $70,000 to do is first bring the researchers to town to present to a stakeholder group, and also to meet with and engage with community members. We need to see what the problem analysis looks like before we propose solutions. But what most cities find when they go through this exercise is there are about 200 people who are really caught up in gun violence, and they're at high risk of getting shot themselves or shooting someone. And our hope is that we can look towards, if we can figure out who these folks are by talking with law enforcement, but also community groups and leaders, that we can then prepare to sit down with them to do what violence interrupters call a call-in, with a group of a dozen to 20 people. And basically, you know, this would be Ron and a coalition of the willing, people who are willing to work with these folks and just say, hey, there are people who are concerned about you. We want to keep you safe, alive, and free. We're worried that if you don't make a change, you're going to kill somebody and end up in prison, or you're going to get killed yourself. And there are people here who care about you. So this request is really intended to let us bring folks to town, let us do really vigorous community engagement, and give Ron the resources to begin to assemble this coalition of the willing, with the goal of, you know, if we can identify a group of people who are at risk, sitting down with them before spring and summer arrives and trying to prevent gun violence. The police department is doing a wonderful job of precision policing. This is sort of adding prevention to that. Yes, ma'am.
I'm in favor of this allocation for a multitude of reasons, but one of which Councilor Gamble mentioned, which is we've already invested a certain amount into it, and so to make that actually work, or to give it a shot at working, we have to make that investment whole. One of the things I'm wondering is there a way to gauge success or to report success? I mean, it's hard to say, well, look at all the people that aren't in jail. but there's got to be a smarter way to do that. So, how many people are you engaging? What were they engaged? What are the activities that these folks were engaged in before? Where are they now? So that we can see where that this is working.
That's a great question. It's almost as if you are at the half-day strategic planning session that the advisory board just had last Friday. Thank you, Dia. We'll be presenting a strategic framework to the group on Monday. There are a couple of indicators that we want to look at. And they're slightly different for the Community Safety Partnership Fund and for this effort that we're trying to launch to locate and help the folks who are most caught up in gun violence. So our advisory board has really thought hard about this, and the folks in the room have brought a real neighborhood perspective. I want to be a little bit careful speaking for them, or because I don't want to get ahead of Monday's conversation, but I think that what we've heard is that there is a great focus on neighborhoods and on neighborhood resilience. And so, of course, we will be looking at crime statistics in certain areas, but Ms. Roberson has also looked at number of additional people being served, growth in nonprofit budget. We will be bringing to council a proposal to support technical assistance from Don Stone at the Center for Nonprofit Management. We want to help agencies grow, not just with Metro funding, but overall as institutions. So we'll be looking at indicators of crime, we'll be looking at indicators of nonprofit health, and we've also started to talk with the idea of working with Metro Public Health Department about looking at indicators of neighborhood health. I'm going to now invite my colleague Dia Cirillo to come up and join us in case, because she's done so much of this work and might be able to speak with more eloquence and expertise on this subject. Plus, it's just fun to be here.
Well, we are at 2 hours and 35 minutes, so I would like to keep this moving along.
Yes, ma'am, apologies.
We have a few folks with a hard stop at 6, and we have somebody else that's waiting.
And I'm ready to make a motion. So I don't know, Dia, if you have a 3-second addition. that you want
I think no addition
5 seconds.
necessary.
Yeah,
I think
take
the
that
only
cue.
addition is that we agree with you that we do want to monitor impact very carefully. So thank you for your interest in that.
Thank you. Thank you all for coming and
Yes.
presenting today and providing this information. With that, I'd like to make a motion that we approve the Cure Violence and Community Safety request of $1,060,000 as outlined in the proposal.
I hear a motion, I hear a second. Any other questions? All in favor of the recommendation of $1,060,000 for Cure Violence, say aye. Anybody opposed, say no. Any abstentions? So we have 6 in favor, 0 against, and 1 abstention by Mr. Henry.
Thank you.
Thank you, guys.
Thank you, guys. You're okay. All right, as somebody with the last name of Wiggins, and we often go alphabetical, I feel the pain for being last. But we do have one more request this evening. We're going to kind of double that with some carryover from the previous recommendation and last night's council meeting. But Dr. White, if you would come forward, anybody else from your team, please welcome our folks from MDHA. They save the best for last, you know that.
Good evening, everyone. I will be brief. I heard a 6 o'clock hard stop, so I know how to wrangle it in so that you all have a lot of time, so I'm not going to give a lot of detail. You have the information in the packet. What I'm here to do is request $15 million for affordable housing, and the majority of this is for infrastructure cost. So as I've heard the members of this committee, very appreciative of all of you, and Mary Jo behind me. I'm just going to take a few minutes because I assume there's going to be a lot of questions for me. So I'm going to take a few minutes to get up a high level and then answer your questions for brevity. So I brought this. MDHA engaged well before I got here. I started September 7th. I think I was here my second week in front of council, and I was brought in here to be introduced by Mayor Cooper and was welcomed to Nashville. This is the Casey and Vision Plan that was a community collaboration over about a 2-year period. This plan involved hundreds of stakeholders, hundreds of residents. There's a committee that was put together, a community committee that was put together for Casey. This plan, as it lays, contemplated building 2,400 units. There are about 2,390 units, where currently 763 sit. The Casey site, as you all heard, is the largest of our sites at MDHA. It encompasses 63 acres of land. So it is a massive site. We have built out about 20% of the Casey site, which represents about 463 units. So we have a ways to go. Tonight, what I am requesting is funding for infrastructure, specifically on the top part of the Casey plan. And what we're looking for is $7.5 million for main sewer separation project. And the sewer separation project affects a couple of areas. So if you think about MDHA's headquarters, which we're located at 701 South 6th Street, everything going to Shelby Street would be affected by this main sewer project, and it's a major project. So the 7.5 is about half of the cost of this main sewer separation project. It will affect 800 units that will be built in that area that we're looking to advance and move forward with the construction. The 5.8 million will affect the area that is on the other side of the administration office, and we often talk in phases, so I put those in there. Our Boscobo 4, 5, 6, 5th and Summer, A2 East, and our Block 23 from our plan. So what this really affects is our water sewer. We had a collaboration process. As part of this plan, it did contemplate using alternative funding. This is a true mixed income, so we have multiple sources of funding that goes into each phase of funding. The reason we're requesting these funding is we're looking at non-recurring funding because we don't want to necessarily create debt on Metro. And these go in, we do the major sewer project that would be oversaw by MDHA. I will be ultimately responsible as the executive director with a team to assist me. So we would be requesting that. The 5.8 million represents about 300 units on the other side with those phases. The offside of this is that it would free up resources for MDHA for affordable housing unit development. And we look at it as we look at funding as we're negotiating with Amazon, that additional resources we would have would yield about 100 units of hard units at our site. So when you look at the 5.8 million, take 100 units at about $150K per unit. That's what we're going to be able to advance by utilizing these funds. So that's the first phase. You heard a robust conversation about crime. Cumberland View is very similar to Napier and Sudicum. So as the executive director, I sat in the back and I heard it and I talked to the resident president. I was on a Zoom with the resident president about things. And what I said to her is what you all have been saying, and I do need to acknowledge, I have a commissioner in the back. One of my board members is here. And one of the things when I took over at MDHA, I was told, what is the priority? What are your projects? we're going to be prioritizing our projects January 20th. Part of our prioritizing is coming up with a strategic plan and what our lift will be over the next 5 years. I want this committee to know that Napier and Sudicum, we've already done a planning process. It's about a $400 million project to do Napier Sudicum. I do not have $400 million, and I would not ask Metro government for $400 million. Let me look over to the COO real quick. I would not do that. So what we're going to look at is how we advance the Napier Sudicum project. So the $300,000 that Ron and John worked on in the mayor's office, I'm very appreciative. I just started when they had started kind of that lead work. That for me is the pilot for what we're doing at Cumberland View. So when you look at the number for Cumberland View, the questions you all asked were spot on. We're asking for hard money to harden Cumberland View. Then we're going to come back with the community process, but Cumberland View will be part of my legacy properties that we're going to look at redeveloping. When you look at our properties and you're thinking between $400 to $600 million to redo these properties with 3 times the density, that's a lot of capital. So I'm not going to be able to do a property a year. We're going to be staggering them. The board and I will assess where we're going. So I knew the $300,000 will be a good pilot. We're going to be addressing some of the crime-related issues at Napier Sudicum with John and Ron, and then we're going to take that model and enforce it on Cumberland View. I do anticipate looking at Cumberland View in the future, looking at Napier Sudicum, redoing the planning of Napier Sudicum 2022. So there's the teaser. 2022, we're going to start looking at Napier Sudicum. But to raise $400 million is going to not be an easy task. So we know it's going to take us time to phase it, but we have to get a handle on the crime and the community issues now. So the $1.7 million for security is literally site work that MDHA would be doing. It does include traffic calming. So we did order that material. As you all know, we got a supply chain issue, so they've been delayed for about 2 weeks. I'm told they're here, but until I see them, I can't guarantee you that I've got them until I put eyes on them. We did do some ballot work, so we had people parking up on near the property, and that was a real concern. We've got sidewalk work. We just authorized a contract for lighting, but have not started it. The difference in lighting at Cumberland View and Napier is NES does the lighting over at Napier and not at Cumberland View. We're responsible for it. So the ask is a harder capital ask of $1.7 million for security measures. Now, this was vetted with members of the staff and with residents. The important part about Cumberland View, I did not bring my resident commissioner, but I have a resident commissioner that lives at Cumberland View. So you can imagine when I started, I heard from her directly her concerns with crime, people parking on the sidewalks, doing the donuts in the middle of the street. You know, there's some shooting there, so I've talked to Chief Drake. We have an extra detail that kind of helps us out with that. So I'm very comfortable with requesting the 1.7 to harden that site. The other was alluded to is an infrastructure lift, and it will cascade. Because if you got 763 units and you build back 2,400 where 763 were, and it's the oldest of our site, you all can imagine what we really need to do. So we're requesting this under this. That does not mean I have not asked the COO, and I will turn one more time, for other resources related to MDHA. But at this point, the $15 million would be administered by me and MDHA. These are the areas that we have. I am going to stop because we've got about 14 minutes to 6, and I don't want anybody to say he filibustered up there and didn't get us a chance. So
We won't kick you out. Go ahead.
Okay, so just really quickly, the Cumberland View ask of 1.7, part of that has already, you've purchased things, you're just waiting. So part of this would be sort of a reimbursement?
Yes.
Okay, which would free up money to do what?
So the money that we would free up from this for Cumberland View, we can apply it to our Casey site. So think about my model. If I got 1.7 million divided by 150K, we would pour it into units.
Okay. So for Casey Place, the 7.5 million for sewer separation, I'm assuming sewer separation means there's existing sewer that needs to be separated from the stormwater, correct?
Correct.
Okay. So we just finished authorizing a large bond issuance for water sewer. And so I'm wondering why this, that I knew that was going to be a question for you, why this wouldn't be a part of that bond issuance, because water sewer sort of operates independently, and I'm continuing to talk for the people that are watching. Water sewer sort of operates independently. There's stormwater fees, there's sewer fees, and so I just want to have some clarification on, because this is a lot of water sewer.
Thank you, Councilmember. That's a great question, and it's one that I asked our water director multiple times. I think there's probably been at least 3 administrations that have had this conversation with our water department. The reality is that we have to treat MDHA as a separate entity, as a separate authority with its own property as a developer. And much like we can't use ratepayer money to subsidize developers out of water sewer, we can't fully fund it as a separate entity using ratepayer money. So we pushed it, I think, to the point of legal comfort, which is it's actually a $15 million project, and water sewer is able to pick up half of it, essentially on their side of the line. But that is as far as law was comfortable with us going. So there's a remaining 7.5 balance, which right now would be absorbed over on MDHA's side.
Sorry, and then so the 5.8, that's for absolute new construction, which typically a developer is always responsible for, correct?
So yes, that's the demolishing of existing units and then redoing the infrastructure where we had units.
So sort of the same thing.
Sort of.
So are you matching, so up, because above that 7.5, that's coming from whomever, and then Metro is?
We're not asking for a match on that.
5.8 is the full amount?
That's what we need for that area, yes.
Okay. All right, those are my questions. Thank you.
Councilman Gamble?
Thank you. Thank you for being here today and putting together this proposal. This really speaks to the issue of affordable housing that we've been talking about, and we've been allocating funds for new units. This speaks to addressing or improving what we have currently and addressing infrastructure needs that we have as well. And I see this as an opportunity to use this ARP funding to address those things that some may argue, should have been addressed or could have been addressed prior to now. But this is a great opportunity for us to use these funds to address these. And for those reasons, I support this this request, and not sure if we have any more questions, but I would like to make a motion barring that we don't have any more. I'll hold on.
Brief math, make sure I'm following the math. So 5.8, it's all new construction, all new units at 150K a unit. Is that what you said?
150 is our gap financing. Our total cost per unit is about 300K.
Okay. So,
And we're
doing
only
the math,
asking for gap
this is
because
close to 40 new units.
Right.
But this is only the gap financing.
This is only the gap because we have multiple layers. We've got tax credits, CITC. We've got home, CDBG. We're hoping to, as Matt's in the back, we're hoping to finalize our deal with for some funding from Amazon. So we have multiple layers of funding, and we're only asking for the need that we need here, which I think is prudent for where we're trying to finish these phases.
Okay, that's helpful. I'll just make a comment based on the other comments I've made today, and that's like, so to me, this feels right. This is leveraging for long term, and to the extent that you can help us understand, not on this one proposal, just pulling back and saying how proposals like this fit into the bigger picture of affordable housing, or the thing like the long-term strategic thinking of where does this, where, 5 years from now, we'll look back and say, all right, we spent X percentage of this money on X, Y, Z. Affordable housing, of course, is going to be one of those, and yeah, I'm just trying to articulate. I like the leveraging aspect that this money has to move us into the goals of affordable housing or addressing affordable housing.
Mary Jo. We, on the administration side, I'll say this, we really love this because it does two things. One, it unlocks and accelerates 1,100 units that already need to get done but are going slower, and this is one of the issues for MDHA. So this unlocks so that they can move forward with 1,100 units of affordable housing. And then it also frees up cash flow, the gap financing that gets leveraged in other ways for 100 units too. So this is a really productive use of these funds.
With that, I'd like to make a motion that we approve the request for $15 million for affordable housing as outlined in the proposal from MDHA.
I hear a second. Any other questions? All in favor of the $15 million funding, say aye. Anybody opposed? I have 6 in favor, 0 against, 0 abstentions.
Thank you.
And can I ask a council member for sponsorship?
Gamble.
Okay. you get voluntold. Dr. White, thank you so much. All right. I said last, but it's not quite last. And I did send you all last night a substitute that was filed. Now, it wasn't discussed last night, but we knew it was coming. So the original recommendation from this committee for $20 million was deferred, and there's a substitute to actually increase it. So Councilmember Sledge, thank you for waiting. Thank you for being here. Councilmember Colby Sledge was the one who filed the substitute. So I wanted to give him the opportunity to present what he was suggesting and then have any questions. And thank you, Hannah, for preparing comments ahead of time. That might help us keep things moving.
It feels very strange to sit in this seat. So very quickly, yes, thank you for all your work that you've been doing on the committee this evening and other evenings. I know that you recommended an original $20.2 million for affordable housing. I sat on the Housing Trust Fund Commission, which oversees the Barnes Fund, for 6 years. And as we've discussed over those years, the need, we always, and I think Ms. Davis will at least nod in affirmation, we always had more projects that were ready to go, fundable, good projects than the money that we had. And typically those amounts were 2 to 2.5 times the amount we had. This most recent funding round there were something like 17 million, I understand, that were fundable projects off of a $10 million grant. And I will tell you, in my experience in sitting on the commission, when potential applicants knew ahead of time what the pool was going to be, it was commensurate with the amount of applications, and in some instances, the quality and number of units of applications we got. So what I proposed after talking with several folks in this space, nonprofit developers and advocates, drawing on my own knowledge, talking with other members, is that I fully and 100% believe that the demand for doubling these amounts to do $20 million for Barnes and $20 million for Catalyst, it will not only be met, but that it is critical. Putting $20 million into Barnes would hit our goal of the Affordable Housing Task Force to have at least $30 million a year for Barnes. The Affordable Housing Task Force estimated that would create around 1,500 units a year. As Ms. Davis has probably told you previously, we're at now, I think, a 7-to-1 leverage point on Barnes. So what's it? Amazing. And so the leverage is there, and I know that's very important for this committee to know that if we're going to put one-time federal dollars towards pieces like that, that you know that the investment return is occurring, and I can guarantee you it is. And then on the Catalyst part, I actually expected to come to you and say, hey folks, would you do 30 to Barnes and 10 to Catalyst? But as I started talking with these applicants, the response I kept getting was, if you put 10 into Catalyst, that's going to be gone like that. And so in the materials that Ms. Davis provided and others in our analysis, they gave us examples of other funds that are similar to the Catalyst Fund in other cities. One is the Denver TOD Fund. Denver, a similar population to ours, they put 15 million into theirs, and they have leveraged it to almost 200 million in private and nonprofit donors. They've done more than 1,000 units off of that 15 million. In LA, which was another example that we were given, they are up to close to 70 million on their Catalyst-like fund. So these funds work, and these funds not only work, but they get those leverage points up to the same numbers, right? 13 to 1 in Denver, for instance. So what I was told was, if you're going to make this, if you're going to go for this, go for this. And I do think that this is the time and opportunity we have to go for it.
So I think that we have overwhelming support at the council level in order to do this. I don't think it was a question, it was about whether the council supported it. I think it was just a matter of respect coming back to this group. If anybody has any questions, that's fine. We're 3 minutes away from 6 o'clock. I think this is just a matter of saying, do we support this? I think that we do. You have the substitute. I think the substitute would pass, and I think at this point I would make a motion to just add she's not here, but I would think she would maybe ask her first, but for at least the two of us to sign on to the substitute, now that we know that we can meet the capacity, that the Catalyst is going to be really effective. If everybody's okay, I just say move to sort of approve. Go for it. Go for it. Yeah.
So I think we have,
it's not really a motion, but it's like.
But I do appreciate, again, and thank you, Councilmember Sledge. He did make the deferral so that, because this was a significant increase over what the committee had recommended, to make sure that you all did hear it. So, you know, if we want to memorialize it with a new recommendation, we can go ahead and make that motion. Right, Alex?
Move to support it.
Okay.
Yeah, move to support. All in favor.
Okay. All in favor?
Oh, sorry.
Yeah, please.
Council didn't have to come back to us?
No.
Will you use your mic? Sorry. A
Sorry.
little slow, but.
Okay. I wanted to understand how that works.
So I'll just repeat it for whoever's watching
Still
at home. So Councilman Sledge wanted to add more money to the efforts for the Catalyst Fund as well as the Barnes Fund. The original question I had actually had was, could we do this? Could we add more money? We didn't necessarily know if we had the capacity. We have since, or Hannah has since looked to see, yes, we do have the capacity, and we've learned more about the Catalyst Fund and that it is effective, and so adding more to it just makes it that much more effective. So really what we're here for now is just to allow the committee to give a proverbial nod of like, yes, we're in agreement that a $40 million allocation is good and not the $20 million. So
and I think it's worth making the point that even at last month's committee meeting, we didn't really talk about if there would be more affordable housing. It would be when.
When, right.
And this is kind of moving up, and Kristen, you may want to comment on just kind of moving up the time frame of it.
Correct. We had already planned on doing 20 million in year 1 and 20 million in year 2. So, but one thing Hannah really has brought to our attention, and I really thank you, Councilmember Sledge, for this, because I think you have an understanding of the bureaucratic processes we have through all of this, is that it takes almost 6 months for us to get the dollars out the door into the community in grants once it goes through all the legislation and contracting and the application process and all of that, right? So we're probably looking at May or June by the time, particularly for the Barnes Fund. This is contracted, and I'm assuming the Catalyst Fund is approximately the same, which is fine on a timeline perspective. Then it takes up to, or often around 36 months for those projects, because they're reimbursement based, to actually come back through. So the reality is we're going to run into the timeline for the grant, the overall American Rescue Plan Treasury requirements if we don't move faster. And so from a cash flow perspective, we're just combining year 1 and year 2 in my mind a little bit in the planning we've done with you all into one time now, and we'll be fine because it'll be coming through, year 2, and we have further treasury funds in place as well. So we're very supportive and we're very grateful for this.
Thank you.
So I guess my motion would be that this committee shows support for the substitute resolution brought forth by Councilman Sledge, and that the council members will sign on to it.
All in favor? Anybody opposed? Thank you all very much.
Thank you, members.
Extra thank you for everybody who stayed all 3 hours and 2 minutes or so. And again, thank you, committee, for your careful, thoughtful.
A final request just from me. If you could send us, like that summary sheet that you sent us a couple days ago, if you can send it sooner rather than later.
Yes.
For my brain to process that'd be
So
fantastic.
it's actually now updated on our website. I will send you all the link.
Okay.
But what I'm going to do is after every council meeting, after committee meeting and we make pending, I'll add them to the bottom. And when council approves, they'll get into the approved.
Great.
Thank you. Adjourned.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.